take her out, okay. If you wanna get down, down on the ground, okay. Don't lie.
All right. I didn't want to play too much of that after it was made for me, which I love it. I've got another version, but it's way, way, way too big. I'm just kind of worried about, if it causes a medical, for somebody. I'm not laughing at that. I like it though. But anyway, this is going to be for me probably a pretty serious. I mean, it is a serious, and this is kind of the direction that I'm going to go. Not necessarily on this channel. I created and partnered up with somebody else to deal with, important issues to me. Desmoid tumors definitely are. Most people don't even have any idea or clue. So had a discussion the other night with some people, and they were really interested. They were actually looking up websites. I looked some up. The one problem I had, I think, is when I was putting in the links, I don't think they actually linked. So you may have to cut and paste until I figure out what I did wrong. I'm pretty new at actually being large and in charge, as you say. And I actually took the advice from someone to take notes, which I actually scripted out a statement, but really that's not me. I'm not going to edit this, and this is why I'm going live anyway, opposed to doing a recording. I don't got skills like that, but basically the purpose of this stream, and I hope, it doesn't take that long, and somebody out there that's looking for information like this, like I was, when a lot of this information wasn't available. Even today, there's still a lot of, things that we don't understand about this, beast, in the community of Desmoid tumor warriors. When I started going through this, basically I was trying to find everything I could, about, this disease, and kind of, if I wish I would have had a doctor that actually knew what they were doing instead of me teaching them. It's getting better and better. It took me 12 years I think 11 or 12, because actually I found an article, and that's, the last thing, part of this video that I'm going to share. But, I had doctors that had no clue for it. And finally at, like I said, 11, 12 years into it, I am on a website, and that's what's pasted there, is a support group for Desmoid tumor, or anybody involved, with Desmoid tumors, or somebody that just wants to be, supportive and, find out about these sort of things. So that's why that, I put that up there, because it took me forever, to find that. And that's the group, that eventually helped me find the doctor that I had. And gosh, my journey started in 2005. Mine ended up being a football size. The original diagnosis I had was terminal cancer. I had 3 to 6 months to live, sort of thing. So right off the bat, it was, misdiagnosed. It took I think a week or two before they decided, because they went ahead and scheduled chemo for me, just in case, even though I'm dying, they thought I was dying, sort of thing. About they wanted me to, heal up a little bit from the surgery, and then so it was 2 weeks after my surgery that I was supposed to have started chemo. So I went in there, the doctor said, good news, bad news, said, Ron, you don't have a desmoid tumor. And it's like, okay, great. What's the bad news? And, they said, we don't know what it is. I handled that harder than I did thinking I was dying. I'm not trying to be a badass. I don't want to die, but I don't fear death, because, regardless of what happens, once you're dead, it's out of your hands. Whereas life, you have to, worry about living quarters, food, disease, obviously that's why we're here, things like that. And I really think this stuff needs to get out there, and not so much just for desmoid tumors, but for all tumors. I'm going to get into how rare this thing is, and even talk about maybe, you know, some other things that are rare. I have, you know, just I'm winging it. Sorry. And really, if this one doesn't turn out the way I wanted it to, I'll probably redo it and maybe do a recorded one and maybe script it a little bit more, you know, sort of thing. But really, the outline, and I'm, like I said, I'm not fancy. I would have, you know, PowerPoints or whatever I'm reading, unless you want to see, you know, this. But we're going to start out with talking about, or I'm going to talk about, you know, what are desmoid tumors, you know, a little bit of the misnomers about it, just how much disagreement there is on some things, you know, within the medical community itself, such as, is it a cancer or is it not a cancer? You know, what's the difference between a desmoid tumor and, say, cancers that metastasize? And we'll probably get into some of these terms as we go. Hopefully I remember to. If not, I'm sorry. But this is my first go at really doing something really serious by myself. That's really, really important to me. I mean, obviously, I live this every day. But after that, we're going to get into some of the genetics behind it. And, you know, genetics doesn't touch everyone in the desmoid tumors. There are people that have these things that they just don't know why they have them, whether it's traumatic injuries or past surgeries or just because. And one thing I wanted to do before I got on this, I had older material back when I was really searching, and then kind of let it, you know, all this slip behind, you know, the curtains for a while, because I've got a handle on it for the most part. But then going back and rereading some of the pages, I had to actually update them just to try to get some of the more current numbers. And some of the numbers that I know are still back from like even 15, 20 years ago, you know, when this all got started for me. So we're going to talk about what FAP is, and my pronunciations on these things are going to suck. So, you know, don't grade me on pronunciation. I'm from Indiana. Give me a break. And then also Gardner syndrome, the two that, you know, I personally have even. And I think on one of the pages it talks about a third actually 3 or 4 different types of syndromes or diseases that, you know, stem from, you know, genetics. Then I'm going to go, you know, what I know. I'm not going to talk about drugs that I don't know about personally. You know, when I was going through chemo, you know, a lot of us talked about what sort of things that, you know, we were on, what pills, you know, it's like a comparing thing. It was like, and I'm making fun of it or minimizing it, but almost like we're comparing pictures of our kids, you know, with our medicine list. And I wish I would have actually taken pictures of all the pills that I have because of this thing, you know, and why I get so anti-pill at times. So hopefully we're going to talk about Nexavar and some of the side effects, and it might help some people understand why, you know, I act. Not even so much act. I'm not using this for a reason or excuse. I'm talking about like memory loss or losing my train of thought, and some other things that I even forgot were even related to it, you know, sort of thing. And then we're going to talk about, well, a lot in the community, and not just the DT community, but anyone that's been through chemo. Right now, I'm not actually on doing chemo per se. I'm doing Nexavar, the chemo pill, which to me, I'm handling almost worse than I am. Well, I did at first, and I'm starting to get better over it. But we'll get to that. We'll talk about drugs and stuff. And then I'm going to bring up, being in the Desmoid support group over Facebook, Deanna, who, is an angel, you know, really. Her and several people run a great site, you know, very compassionate, everybody very supportive, gets information out there. They did, and I can't remember, I think it's 2016, there was an article that was done about this, and I think I want to say over in gosh darn it, I can't remember, Tacoma maybe, or somewhere on the West Coast. But I was interviewed, so were several others, and I want to, you know, not necessarily share the whole article per se, but at least what I said, you know, in my quotes, and how, you know, a group like that helped me, sort of thing. Like I said already, you know, spoiler alert, I guess. That's where I found my doctors at Indiana University. Well, actually, let's say Simon Cancer Center. That's associated with IU University in Indianapolis, Indiana, which is right next to the IU Medical School. Which, I guess, real quick, and I won't touch on that too much later, but the first time when I had terminal cancer, when they said they didn't know, they took the pathology, sent them all over the world, literally all over the world, came back. Nobody knew what it was. They basically wanted me to sit back and wait. And I had a football-sized tumor in me that they didn't even know was there until they went in to do unrelated surgery, which I'll try to stop there because I'm going to touch on that with some of the like FAP and Gardner syndrome, side effects sort of thing. And just for anybody that's it pops in here right now, I'm going to probably talk for a bit, then check chat, so I don't get distracted because I got a good night's sleep just so I could do this. But I do lose track, and I do stupid stuff like last night. I set this all up, and I thought I had it for AM and it was for PM, but I got up and it's like, what do you mean I was supposed to do this yesterday? Then somehow it got changed, or maybe I just didn't hit save. And I think that's what I did. So that's why it was still there for the 4th and not today. Because I wanted to get a good night's sleep. I've had a rough, a few nights sleeping, staying up all night talking and stuff like that. So first off, thanks everybody that comes in or watches this, in the future. I hope it, at least helps one person or one person that knows a person that has one, maybe understand it. I'm sort of thinking I'm also going to do, I don't know if a series, but I think my next follow-up, I have follow-ups every 3 months where I have CAT scan, blood works, and then see my doc, my oncologist. So I'm going to videotape as much. I got to figure out, what's acceptable, what's not acceptable, because I don't want to get people in it. How you on the news you see and they're all blurry face. So I got to figure out how I can do that from, pretty much I want to do it from the parking garage to, how far I walk to go get my CAT scan, depending on what side of the hospital that is. Because sometimes the Simon Cancer Center is booked pretty good. So I'll have to go through actually IU University, which is, in the front of the hospital. But anyway, then my journey to labs, which is the same area, hopefully be able to get some video of what IU the multi-diagnostic cancer, part of that is, and even maybe so much to, the process of, going through the blood draw, because I have what's called a port. When you do chemo, you don't want to get an IV every time. Plus, if you're dehydrated, it's a bitch, or if you blow out a vein, it's a bitch, because then they have to turn around and do it again. And so they got, and I don't know how well you can see it, I got a tattoo right next to it. And when they did, I put my port in, the doctor tried his best to avoid the tattoo that I had, but it's just a bump there. And it's just a little clip kind of thing. It's got a needle that pops in there really easy, and then they hook up and either do blood draws or the infusion. They flush it real well. There's a big risk on blood infections. The last one, I wish I would have looked that number up to be more accurate. But back when I started in 2015 of December, the doctor I had, my doctor was telling me about this. And I learned actually more in 5 minutes with that doctor than I did my 11 or 12 years prior to that. I also kind of want to get more into this and my story and how, and the, just basically my story, some things I should have been, probably left off of this one to do on another one, but a more complete, more, because that's another thing I heard, a lot when I was talking with somebody about doing this. That and much like I'm also an atheist, I'm not trying to drive anybody away that's looking for this information, but there's things that I guess if you share your testimonies or your journey or your whatever, somebody, and for me it definitely was true, because I felt, and many out there or anybody that's looking for this information, may realize that you feel like you're on an island. No one knows how you feel. Nobody can relate. I mean, as much as I've always had a great support system, but they really can't know how I feel, if you don't go through it, sort of thing. So yeah, I want to do something more in depth there. But anyway, this is basically going to just be some of the websites that I've used and have actually, give to other people that were searching for, information about these sort of things. The one, like I said, is the one that, hey, Barnaby, like I said, I'm going to take maybe a little bit breaks just to try to catch up with chat, but not to offend anybody. Chat right now isn't, my priority. God, my hair is not doing so good. But anyway, so I'm going to just share some videos, or not video, excuse me, gosh, some websites, do some reading, and hopefully I don't. I'm long-winded for those that you don't know me. Obviously, we're 16 minutes into this, and I haven't even got to it. But so let's get going. This first one, sorry, I got to get this window put up, but I hope that's the right one. Sorry, like I said, I'm new to this. Yeah, 8 things to know. This and this gives a pretty good outline, but a lot of the stuff that I use specifically, because they've done so much work and so much fight, especially trying to get DTs, desmoid tumors. For those that didn't catch that, but in getting it to be classified as a cancer, because you'll find in the community, even on these pages, like with numbers, or is it a cancer, is it not, they all are kind of don't agree or kind of contradict each other, but they really don't, sort of thing. But maybe I need to bump this up a little bit, make it a little bit bigger. There you go. I hope that helped. But basically, and I don't know if I necessarily agree with this first statement, and I'll give you, some personal things as we go. But according to this, desmoid tumors are slow-growing, locally invasive tumors that develop in the body's connective tissues, also known as aggressive fibromatosis. They're treated with many of the same therapies that are used on soft tissue cancers, like sarcomas, and including surgery and therapy. We'll finish this first part up. Not everyone considers. Here we go. This is like the debate about whether it's a cancer or not. But not everyone considers desmoid tumors to be cancerous. So are desmoid tumors benign or malignant? And how are they usually diagnosed? So we'll get kind of into this sort of thing. But what's kind of funny is there is not much difference from being treated for a desmoid tumor. Say if it wasn't a cancer, then somebody with cancer. We have all the same tests. We use the same chemos. We use the same doctors. We use just anything that's related to cancer. You could probably apply to DT treatment. The one good thing is that, like I said, my journey started in 2005. So 2005 until I believe sometime last year, desmoid tumors didn't have its own drug, to treat it. And on my journey through chemo, my body just couldn't handle it and finally broke down. That's why I'm on Nexavar, sort of thing. And they were actually talking about we're in the process of trying to get a drug, and I can't remember what the name it is of it, and I'll actually research that for my next video, that is specifically for desmoid tumors. And the last time me and my doctor talked about it, because I want to say, I think in November-ish of last year, it was supposed to be approved, and I was actually going to be one of the first ones to be actually put on it, other than the test groups. But since Nexavar was working so well for me, we were going to stay on that. The problem that I ran into, and this is why we were talking about getting put on it, the new one that is that it's a $2,800 a month pill, out of pocket. through Bear. Bear had a a patient health program basically. So they covered all of mine for, gosh, I can't remember how long I've been on this thing because I stopped like I think 2018 till now. I've been on Nexavar, might be 2019-ish. I have to go back and look, but I'll be more accurate. Hopefully, when I do, my journey thing. But so they canceled it last year. I mean, and I got kind of lucky because there were people that were cut off of it. I think the letter that I got came out and was like dated April 7th, and they were telling some people, they were done, the first of the month, sort of thing. Whereas mine had to the end of the year. Well, the end of the year came here, and all of a sudden it's like, okay, what do I do? And this causes a lot of stress, a lot of anxiety, a lot of what the health sort of thing. And for those that don't know me, I do cuss once in a while. I'm trying not to, during this video so much, but excuse that part of the video. That's not the purpose. So, but anyway, and then, oh, thank goodness for Simon Cancer Center Farm. They called me, got some information, basically put the same application in, and finally found a group. And I want to it's the On-Call 360, Oncology 360. It's a group. They are covering the whole $28, however they do it. So I got lucky. So for at least this year, which would be the end of December, I'll, I don't have to worry about it so much. And the one thing my doctor that took over from my old doctor said is, don't worry, we're going to get, take care of you one way or the other, and then also, plan B was that new drug. But it was, yeah, I hate to keep talking about that drug, but anyway, sorry. Get kind of into, whether it's a cancer or not. First off, it is benign. No desmoid tumor metastasizes or becomes malignant, I guess, meaning that, it doesn't turn into, let's say, true cancer. Then you're kind of screwed there for a little bit, go in a different direction. But when faced, with a binary choice like this, the right answer would have to be yes, they're cancer. But there are important distinguishing characters, like they're very low grade, slow growing local invasive tumor. And really quick, the reason I have a little bit of problem with this is the fact that I mean, honestly, I don't know how long, no one can, knew how long I had, or when my tumor started. They just happened to find it, like I said, unrelated surgery. But I had it removed 06, like February or March, had radiation in October of 06, and by sometime prior to January of 09, because I started getting sick, went back, they did another CAT scan, because basically I had no monitoring going on. They just let me go thinking everything was fine, yada yada yada. So I learned fast after that yeah, if they get this out, if I survive, or whatever, because I really didn't know if it'd kill me or not, or if it could, because there wasn't that much information, like I said. But so from October of, well, I say November, or no, actually, since I had it taken out, it would have been February or March, beginning of 09, and it was back, by the beginning of, or no, excuse me, they took it out in the beginning of 06, and it was, they at least verified that it was back by 09. So there's a 3-year period. So I don't know if that was necessarily considered slow growing or in the carcinoma world or not, sort of thing. Desmoid tumors can grow to impressive sizes that cause serious symptoms and make people miserable. I guess for me, it was a win-lose situation, because like I said, mine was the size of a football, and they didn't know it was there, but I didn't have any symptoms when I went in, and the surgery that they were doing was related to, basically I had acute pancreatitis. And once again, I'll share the rest of that in my story of, it's kind of like lucky, that I had that surgery to begin with, or, who knows how long it would have done and how much damage. And once again, like I said, desmoid tumors never metastasized. Most of them are localized, but if they're large enough, they can compress, infiltrate. Anyway, sorry. Surrounding structures causing symptoms, but desmoid tumors cells don't travel around the body. Meaning that if you get it in your arm, generally it's not coming in, popping up everywhere. There are, and I'll probably touch it later on. But in rare occasion it does. It's called, I believe, multifocal. But generally they don't. They'll finger out, they'll get bigger. But if you get one in your arm, chances are you're not going to get one in your leg or your abdomen. And we'll touch on as we go where and when you can get these. I'm going to stop for a second so I can see chat, if there's any chat. I don't want to be rude. Okay, there we go. Actually, I think I'm in here alone, and that's fine. Oh, wrong page. So sorry. All right. So about 1 to 3% of patients are predisposed to developing multiple. Oh, I should have waited. Right there it is. Multiple desmoid tumors. Like I said, it's called multifocal. Do desmoid tumors have any side or symptoms? Most desmoid tumors arise in extremities such as arms and legs, but sometimes they develop in the abdomen too. So the symptoms developed on the tumor size and wall, or depend on, for tumors in the extremities, patients usually notice a mass, because if it gets big, obviously, if there's something in your leg and it's in your muscle, it's going to pop up. Just like, even if you have a little like cyst or something, you notice that, so you kind of get worried or think of that thing. But these are a little bit different. For tumors in the abdomen, which is where mine is actually mine's in the. Well, we'll get to that later. For tumors in the abdomen, symptoms can range from mild pain or vague senses of discomfort or heaviness on one side, and of course that lump I was talking about. In extreme scenarios, patients may develop a bowel obstruction, which is kind of where I'm at now, or through all this. But and like I was talking about the genetics, to actually determine what kind of tumor you have, they do biopsies, and I didn't do biopsies. And I don't know if they actually will stick the needle in there and try to extract some there. But the way they took my biopsies, I was already they already cut me open. We're going to do and actually what it was they're going to take a foot or two of my colon. So when they're in there, they saw this, they freaked out. It was a small hospital. They took biopsies, and like I said, they send them all over the place, sort of thing. And from what I've heard from other people that I've talked to with this, they're actually getting better and better at diagnosing, these things, or at least getting the biopsies to show that it is a desmoid tumor, not go through like what I did. But I've known people that have done 3, 4, 5 biopsies even before I had it. And, I thought, oh, wow, I just happened to get mine in the right period of time. And it's like, no, I should have waited 10, 15 years at least. And really how are, desmoid tumors typically treated? Really depends on if you got a doctor that knows what they're doing or not. But if you can find a doctor that's treats these, they definitely take a lot of their advice, but definitely ask questions. But desmoid tumors tend to wax and wane in terms of size, growing slowly for a while, only to turn around and become stable or even shrink. And that's where I'm at on the Nexavar. Mine is stable. It shrank a little bit, but for the most part, it's the same size. And mine that I have right now, I'm told, is the size of I'm going to say football again, softball. And mine is, just to tell you about where it's at, because right now I'm experiencing, or what it's going through. The last time they went in to do what they call a Whipple, and they couldn't do it because my tumor is balling up around my intestines, or actually probably more like my small intestines, what's left of it. And when when I eat, it actually travels through the tumor because of this. And I have, at times a blockage. And the bad thing about a blockage is that you can't eat, you can't drink. I mean, obviously you can't pass nothing, but then again, you can't take your pills either. So you end up purging a lot. And this is how I found it was back. Those were the symptoms I had. Just like a clock. I'd feel fine. 15, 20 minutes later, I can feel it growing in an intensity of, what's going on. And this would go on for, maybe a day, sometimes up to weeks before I finally said, hey, I need to find out what's going on, with this. And even going to the ER, before, seeking help, really, they had no clue what was going on. But generally, even now, and this is the treatment, if I start getting sick to that point again, I go to the ER for fluids. They'll give me a shot of, anything for the pain, and then something for the nausea. And it's the best thing. And then, for me, I think it's a dehydration thing, that intensifies it anyway. But let me see, by watching and waiting. So we'll start by watching and waiting first to gauge the tempo of each. Yeah. But see, I went through that, but they were wanting me to watch and wait without even knowing what it was, sort of thing. Like I said, what was this? Excuse me. But there are certain cases in which you need immediate treatment if a desmoid tumor is causing severe symptoms, for instance, or growing in a location where it could cause serious complications such as bowel obstructions, which is what I was talking about. We'll look at whether surgery is an option or not. So just so I can maybe help you relate to what I went through, that's when I found out my tumor was back and I was having those symptoms. That was in January. By February, they had me in for surgery to go back in and hopefully remove that one. But like I said, it's wrapped around things, and you just can't cut stuff willy-nilly. Especially, what makes this so destructive is the fact that, like I said, the first one was the size of a football. They didn't know it, and I just had a whole series of CAT scans. That's related to the acute pancreatitis that they found, and they didn't see it. They thought I had, and they literally said, the only thing we can see really is, other than they figured out I had acute pancreatitis, is that my organs appeared to be a little bit larger than normal. So wow. But a few months later, I found out that's a football size, tumor. But anyway, when they went in to take out the softball size one that I have now, they couldn't do it because it was wrapped around that, like I said, and is also getting into the blood vessels. The problem with that is they're so small that if they cut one, there's no way to repair them. So whatever that is feeding literally is going to end up dying. If you cut off the blood supply, it has no way to, thrive. So that, that's another thing. So they're really cautious about that part because, let's go ahead and get the tumor out. But he died because, say whether it's the liver, kidney, maybe, whatever it is. I'm just, whatever organ it might, or even, maybe nerves. I'm not even sure how deep that would go, but you can see where that could be an issue. Like I said, the first time when they finally took it, or my second surgery, when they finally took it out, I went through intense radiation treatment. And I mean, so intense that Dr. Pugh that said he'd been doing this for 40 years, just to give you how long he's been doing it. Like I said, I had radiation in October of 06, came back by 09, and Dr. Ye had taken over for Pugh because Pugh had retired, which I love both doctors because Ye actually was working with Pugh when I was in there, back the first time. So, I can never have that. And, Dr. Pugh said he had never given somebody so much radiation in his life. And even to a point now, they worry about even, some procedures that might have a little bit of radiation, from it for a normal person. For me, it's even worse because you really don't necessarily get rid of radiation out of your body overnight. It's a process if you ever do, and I'm, from what I've been told, I never researched that, never necessarily cared, but it wasn't fun. And this is kind of what I was talking about, the genetics. about 20 to 25% of patients, now this is not the population, this is the patients that actually have the DTs, carry a mutation in the APC gene that causes a condition called what I'm going to get into. I may not even have to. I forgot that this is in here. That it's called FAP, and I will blow this pronunciation: familial adenomatopsia. That's it. Okay, there you go. You can read just right there, just in case. Sorry, I'm a country boy, but this makes sheets of precancerous polyps grow in the intestine tract. That population also has a 50 to 60% probability of developing MTD, Macenta trick, Desmoid. You think I do? I have this thing. I'd be able to pronounce these things, but I can't. Sorry. Which grow deep inside the belly. Their development often stems from surgical procedures. So, like I was saying earlier, most of the time they do genetic testings, and really the genetic testing, if you've already got, and this is just from personal knowledge, and I don't know if they're going to even get into this, but is that if you've got it, you at least want to get your children tested. And like, say, if you test the kids get tested for some reason, then they don't have to worry about testing their kids. And I don't know why that works or how it works, sort of thing, because it's been so long since I've thought about this, any of this stuff really, other than my day-to-day living. So, yeah, there's people that are, like this one says, from a surgery thing or what have you. But the classic scenario is, maybe they are going to get into this, is when someone with a family history of cancer has polyps and discovers they carry this mutation, then follows their oncologist recommendation and has an entire colon removed, which is what happened to me. The surgery, because when I had a colonoscopy, I had a colonoscopy, literally he said hundreds and hundreds and hundreds of polyps. And at that time, he thought it was just in my digestive tract. And he said that he could be in there for, literally days and still not get every one. And the main concern and the reason why he's so concerned about that, which it'll be touched on later, is a lot of times if they don't get it or you go untreated, I believe they say that, and we'll actually get into that, I'm sure, but almost 100% of the people that have desmoid tumors, I believe it is, or is it the FAP or Gardner's? See, I'm going to re-educating myself right now, but literally untreated, if you have this, you're guaranteed to get colon cancer, basically. So yeah, you don't want that. And then that's why I'm kind of glad that my tumor came back, because I could have went the rest of my life, even after they took it out, and then end up, getting colon cancer or a few others. So let us see. Where was I at? Discovers, mutations, then follows their, but then 6 to 18 months later, a CAT scan of the abdomen or pelvis reveals a nodule at the drain site or a mass at the roots of the mesenteric. God, I don't know if I can't say the other one. I can say this, but I can't say the other one, which is the membrane in the abdominal cavity that holds connected organs in place. And a biopsy will show that it's a desmoid tumor, and hopefully it gets sent to where people could actually identify it. Like I said, I went through it twice. No other people that have went through it 3 or 4 times before they really found out what it was. Why is it important for people with desmoid tumors, or even with one of these mutations, to seek treatment at a place? And I believe this is, MD Anderson. They've got great, information, but so does the Mayo Clinic. Some of the bigger ones have more and more information about this. But like I said, my go-to would be the DTRF.org, which is the Desmoid Tumor Research Foundation. They're just right on it. And I would have used their one. I'm actually going to show, their what is a tumor, to show you maybe some of the comparisons, just a quick rundown for it. But I just kind of like this, had a little bit more information because we're about to the end of it. What's the most important thing you want people to know about desmoid tumors? If you have to have a soft tumor, this may be one of the what's the most important thing you want people to know? Oh, okay, I'll get skipped. I sorry. Okay, so then I'm going to go to, like I said, the DF. I have trouble remembering, like in the trans, when they use the LGBT, I have trouble remembering letters and that sort of thing. So sorry for the kind of, and I'm gonna kind of get into that when I get to the chemo brain part of this. But yeah, this is the DT. I'm looking at that now. I can see the DTRF, Desmoid Tumor Research Foundation, and I consider them the experts on this, to be honest. But really, it's a lot of the same stuff. I'm just trying to see if they have anything. Yeah, common sites include abdominal muscles, including the abdomen, the head, neck area, the trunk, the breast, and the extremities, arms and legs. Desmoid tumors do not have the ability to metastasize. We've got into that a little bit, kind of got into the cause, but I'm going to read this a little bit more, and hopefully maybe they'll say something about, not really even knowing from the majority. Meaning it's clear cause or... The majority of desmoid tumors occur spontaneously and randomly, meaning there is no clear cause or pre-existing condition related to the tumor. So in other words, if you have one and you get genetically tested and it doesn't come back that you have FAP or Gardner syndrome, there's a few others, then really they're not 100% sure. They might, I've heard that a lot of women that have C-sections, to give you an example, that get it. I'm not saying all women that are, have C-sections are going to get this by any means, but I'm saying, if they have one, generally it's in the C-section scar tissue, and they think that scar tissue and trauma has something to do with this. These spontaneous desmoid tumors often have a mutation in the beta carotene or catenin gene. There we go, CTNNB1. The mutation is a change in the DNA or blueprint of the gene. Importantly, in this case, the mutant beta, I'm going to call them BCs, gene is only found in the desmoid tumor and is not present in the other cells of the body, is not inheritable, and cannot be passed to children. On the other hand, okay, hopefully they're going to talk about children. Approximately 5 to 10% of all tumor cases are related to rare genetic conditions known as FAP. We touched upon that a bit, sort of thing. Signs and symptoms, which is, maybe they have more here than the other one did. Tumor location can include pain, swelling, visible deformities, meaning, and I almost thought about getting some pictures. And then I decided not to. I mean, first of the tumor, what a tumor can look like, because they're ghastly, but every tumor is. And then, but I don't want, I don't know if I need a trigger warning, or whatever for, or people are queasy, or just even like scars, pictures of scars. And I will show one scar just to give you an idea. And it's, and it's on the interview that was done. And it's not even mine. And it's of the leg of where one was. Excuse me. Impact on mobility, pressure on nearby organs, affecting bodily functions such as urine and bowel function, breathing, or swallowing. By contrast, some patients may have no symptoms at all and no visible physical manifestations of this tumor. And I'm one of those. I didn't even know I had it. They didn't know I had it, and didn't know until they went in to do something else. I'm not going to do, we kind of touched on whether it's a cancer or not. I think this is what they're getting at. Yeah. But the one thing, I do want to share at least this part. And this is kind of why there's still even debate, but patients often ask, are desmoid tumors cancer? The classification set out by the WHO for soft tissue tumors are the most decisive and descriptive on the question. The WHO classifies soft tissue tumors, or what are known as carcinomas, in the following 4 categories. Either they're malignant, meaning that it's cancer, or intermediate, meaning, or sometimes metastasizing, and then desmoid tumors are considered immediate, locally aggressive tumors. And then you have benign. So that's where it's at on the World Health Organization's kind of classification, or whatever they call it, for tumors. All right, here we go. This gets into, and this is, what kind of doctors treat. And seeing, this is one thing, even after searching for one, I didn't know this until I went back and reread this article just to see how up to date it was. And I actually had to update the one that I had. It's just a little bit different, but I think the numbers were a little bit more current. But anyway, I just looked for a cancer doctor, period. That was it. I would call, I did find one, actually, I did find one doctor that did treat DTs before, and it was at, like I said, I live in Indiana, so I called the Chicago Cancer Center of America, and they said, yes, we'll help you. We can help you. Got my hopes up. And one thing I will say, this journey for anybody, it will, even just cancer, it's a roller coaster. You're going to have your good days, your bad days, and this was one of, within 2 hours, I guess, being on the phone, I went from cloud 9 to, WTF. That's all I'll say. But the doctors there, or actually, and the reason I couldn't go there, the insurance, even though I had 100% coverage, and that's why I took a $6 pay cut from a better job for the benefits of where I ended up working before I was put on disability in 2016, because it was 100%, saved me all kinds of money. But the Cancer Center of America doesn't take that insurance. So here I am thinking I found an answer, or at least some hope, and then all of a sudden, no, we can't help you because of money. You talk about devastation, to be honest. But yeah, anyway, the doctors that specialize in DTs are sarcoma specialists, which is a group of oncologists and expertise in treating sarcomas, which are soft tissue tumors. Like I said earlier, or that they said, sarcomas are rare type. I guess they're getting ready to tell you what it is. Sorry, are rare types of cancer that form in the connective tissue. Yeah, we talked about that. For example, muscle, fat, blood vessels, bone, even, and cartilage. Because desmoid tumors also arise in connective tissues. They are within the preview of sarcoma specialists. So yeah, I would definitely, if you're looking for one, try to find a sarcoma. But if you can't find a sarcoma doctor that's actually treat, first off, it's almost a miracle. And I guess it's getting better. But back when I started, it was a miracle for a doctor to ever even hear of what a desmoid tumor is, and such. I think we're getting the numbers on this one. I think this is why I kept, because I keep waiting for the numbers just to show you first how rare this is. Second, why it hasn't been heard, and why it's at least for many people, not even my age. I know kids, kids that were in there, having to hope, for some kind of something that happened. But yeah, once desmoid tumors can vary greatly. Treatment monitoring is determined on an individual basis, depending on location, size, and symptoms. I go to my oncology. Well, like I said, I have my CAT scan, blood works, and see my oncologist every 3 months. And that's been going on since I've been at IU, sort of thing. And I'll get more into it, and I've actually, it goes deeper than that. But when I do my testimony or story about this, I want to sit down and actually make it more fluid and coherent than this is. Like I said, I'm winging this just to get the information out there and really to get a feel for it. I'm going to go back and rewatch this, but I may end up redoing it, but I doubt. I don't know. But here we go. The rarities. Are desmoid tumors considered rare? I should have brought a calculator because I'm not that smart with math. Yes, I am. But anyway, yes, DTs are distinctively rare tumors with an incident of 5 to 6 cases per million of the population. And I think these numbers are based in the U.S. too. And the reason I'm going with this one, but there's other sites that'll say that it's like 1 in 2 million or 1 to 2 per million. So there's a little discrepancy, but not like a whole lot. It's still rare, sort of thing. A disease is generally considered rare when it affects fewer than 200,000 people in the United States. And there are 7,000, rare diseases, not just, DTs, but, I guess total or close to it. An estimated, 25 to 30 million people are living with a rare disease. I'm one of them. Desmoid tumors can occur in anybody of any age. Like I said, I've seen kids, and it just breaks my heart, with a peak age of 30 to 40. So if I found mine in 05, oh gosh. So 1920. So mine was found when I was my mid 40s. Sorry, I'm not going to try to do the math for that one. And the other thing I wanted to say is, considering, and I looked up what I found, it was like 334,900 million people that live, and I just rounded up to 335 million people that live in the United States. So figure that out. 5 or 6 per million, with a population of 335 million people. And if it has to have fewer than 200,000, this number is way below. So you get a feel for it, how few people get it. And I want to say, because I don't know if it's going to pop up, unless I took that one down. But I can't remember what it was. Oh, I know what I was going to say. But the one page I was going to use, but the only reason I was is because of this. They had like little snippets, and one of them was that there's only like 900, and this number has changed because when I started, the number was like 900 to 1,200 new cases a year. That's it. The other one that I found with that had any sort of number like that, said 900 to 1,500 a year, and a lot of that has to do, and that isn't inaccurate because so many people who have this get misdiagnosed, what it is, because of their doctors, and the doctors not knowing, not aware of it, not, so that number is probably higher than that, but not by much. And that might even be why they use this, 5 to 6 opposed to the 1 or 2, whether it's just a disagreement or maybe it's just, part of that's compensating for maybe, a percentage they think that's being misdiagnosed. Given the rarity of the disease and lack of awareness outside of the sarcoma specialist, desmoid tumor, here we go, are often, sorry about that, misdiagnosed, which can lead to improper clinical treatment. We highly recommend you seek out a sarcoma specialist at a sarcoma center if you have been diagnosed with a DT, to ensure that you receive knowledgeable and appropriate care. And I strongly, I think I've said this a few times, I can't stress that part, enough. The one thing, and I don't know if they'll talk about reoccurrence on this one, but I'm going to say it anyway. The one thing, like I said, I had no knowledge of this. And earlier it said, usually the first step is, or the second step might be surgery. First step might be if it's life-threatening, sort of thing. But the thing that most doctors don't know or don't tell their patients is, hey, if we do the surgery, there is a 70%, and that's the last number that I've heard, 70% chance of reoccurrence. So if you get cut, more chances, or it's more likely it's going to come back. So that's why it's so important to, definitely have monitoring by a doctor and testing. Like I said, they do a lot of CAT scans, blood work, yada, yada, yada. Yeah, this, I'm going to skip because I think I pretty much covered. Oh no, it is on here. So sorry. Just some quick facts. Probably stuff that's already been mentioned. But like I said, 900 to 1,500 cases that diagnosed each year. DTs are rare. There you go. They're saying approximately 5 to 6 out of every million have this. So, and here we go. The exact number of desmoid tumor cases is difficult to calculate due to inconsistent reporting and analyzing of clinical cases and frequent misdiagnosis. Once again, it's most common in people 30 to 40, and even worse is that they are more common in women than they are men. Women are 2 times more likely. And my guess, like I said, is like since some women get C-sections, if that is really what causes this, if they ever find out, that might be part of the difference, or maybe just the way they're built, or I don't know medically what it calls. Spontaneous regressions in 20 to 30% of cases. First line treatment, active surveillance. Definitely. Active surveillance is the attempted first line treatment in most cases. Second line treatment, surgery. Surgery is the accepted second line treatment for only sporadic or sporadactic, whatever, DT located in the abdominal wall, failing observations. And that's, like I said, that's where mine is. I think that's pretty much. They got a lot of great information on here. They've got resources, and I should have probably done that part. Okay, I'm going to there's the FAP part. I'm going to take a look at chat just in case somebody might have popped in. Okay, nope, that's fine with me. Here we go. Oh, where's it at? Boom, there we go. FAP is a hereditary syndrome that raises your risk of developing colorectal cancer, as I mentioned, to nearly 100%. Cancer develops, from ACPs, which can appear in hundreds to thousands. Most people with FBA will have their whole colon removed. That's what I said. I had so many, whether hundreds or thousands, and had actually, technically, I had like 6 or 7, I don't know, inches that they kept, and right now that's kind of an issue for me. And this is because back then, whoever treated it, my doctor, who was a good doctor, a surgeon, they just weren't aware of what this was, and they should have just went ahead and took it all. But anyway, they cut a foot or originally they wanted to cut our foot or 2 of colon out. Well, they ended up doing, taking all my colon and part of my small bowel because of part of it was because it had so many polyps, and second, because the tumor was starting to wrap around it and attach itself to it. And I was lucky where I didn't have to have a colostomy bag. But literally, if I have any damage to any more of my small bowel, I will be bagged the rest of my life. And I'm not looking, for that whatsoever. FAP is a genetic order that disposition or predisposes you to develop precancerous colon polyps called, that anemomeas. I just call them polyps, but they call, but I always go with, that's why I like with my drug, Nexavard, it can also be called sorafenib, but I use Nexavard because it's easier. They aren't cancer, but certain types like these can, and I've actually have some of these, and that's why I have so many. For me, I have upper and lower GIs. There for a while, they were doing those every 3 months. Then I got down to twice a month, or not twice a month, twice a year. Now I do it once a year. But I'm in there a lot longer than I would if somebody that didn't have as many as me, I guess. because the GI doctor, sorry, actually spends a lot of time, even though most of them are under control. I mean, they'll do biopsies just for precautions, but then they also go by look. There's certain things, and I can't remember what they are right now. And I wish I should have had some of my upper and lower GI papers here, like the pictures. And I want not to show the pictures, but just to read, the diagnosis and what's going on, step by step sort of thing. But many people that get the polyps as they get older, or many people get a few colon polyps at random as they get older. But if you have a hereditary polyposis syndrome like FAP, you'll develop many polyps. But I'm going to kind of get through this a little bit faster. What is the estimated cancer risk with FAP without treatment? The risk of developing colorectal cancer with FAP, it's close to 100%, like I said earlier, they said. And I'll say this afterwards, but anyway, besides, the risk of that, if you have FAP, you also have an increases of other tumors, as you see. I mean, I've heard people, well, 8% and 2% ain't that bad. Well, any percent that raises it is bad. Like stomach cancer, 1%. Oh, I failed to mention though, and the reason I have upper GIs as well as lower GIs at the same time is I have polyps that not only run through my digestive system, I also have them from, actually from stem to right about where the esophagus is. And they're quite numerous in there, but we may run into this. But if I remember right, the ones in your stomach aren't so likely to become cancerous. Actually, I would say that is the case, since like stomach cancer is only increased by 1%, and I just said only, but I mean, it's not like 100% like colorectal cancer. And there are different types of FPA. There's the classic whatever that one is, and Gardner syndrome. I also got Gardner syndrome, which is basically FAP, but it's a I'm in a subsect, I guess, of it, and I'm going to talk about Gardner syndrome next a little bit with that. But like I was talking about with genetic testing, there are more than one variety that you could have, and I think there's even a John's. I'm not even going to try to guess what they were though, but like Turcot's, I never heard that until just now. Until I just read, or last night when I was checking this, how common it is. And what's not funny, strange is if it's rare, I'll get it. First off, getting a desmoid tumor is rare. Getting FAP is rare, but it's not quite as rare as the tumor itself, except, and I'll get into when I get into the Gardner syndrome. But FAP is rare, estimated to affect about 1 in 8,000 people. It accounts for only about 0.5% of all colorectal cancer cases. Varieties like there are rarer. Like I said, I've got Gardner syndrome, which is rare. They represent about 5% or 10% of all FAP cases. Here's some other ones. It's comparing FAP to Lynn syndrome. I'm not gonna get much into that because I don't know anything and it hasn't affected me. But if you do, obviously, I mean, if you've watched this and you say, "Oh, I know what that is," and that's what I'm looking for, there's some information on here about that. What causes it? And let me see. They usually won't cause symptoms until they're grown large enough to be dangerous. But if you have colonoscopy for screening, and that's an important thing for colon cancer, colon rectal cancer. Generally, if you get the monitoring, and not even if you have FAP or anything else, just as you know, a person. Um, it's not necessarily fun to have a colonoscopy, but it's not actually that bad, considering that if it catches this, you know, I'd rather go through, say, a colonoscopy. That's what's weird. I don't remember how often a person, and you know, a healthy person gets one every 3 years, 5 years when you hit 50 or whatever it is. But definitely, whether you have this or not, make sure you get screened. So you do not want to go through colorectal cancer or any other sort of cancer. And let me see. People with FAP often have hundreds. We've been through that. The greater number of polyps. Symptoms are rectal bleeding, diarrhea, or chronic abdominal pain. Yeah, affects the bones. You have cysts, and I'm going to kind of summarize this once I do the Gardner syndrome. And then something else that I learned. I did not realize that you know, extra teeth or impacted teeth, you know, which I know I don't because I've had, you know, X-rays. Pigment lesions on the retina. I mean, there's so much stuff that I didn't know. I'm glad I'm actually doing this, whether anybody watches this ever or not, because I'm imagining this is getting kind of long. I may have to cut this in 2 parts, or have somebody do it. I don't know how to quite do that yet. I got the program, got my new computer up to do this. I just got to figure out where to put it in my house. What is the main purpose of FAP? It's caused by, it's just regurgitating. A lot of this is the same stuff as just even the desmoid tumor, because they're so connected, or they can be. I mean, obviously. Here we go. Just a list of stuff, you know, like the polyps, you know, which I have them, like I said, from stem to, you know, my throat. Just had, which I'll get into in my my journey story. But bile duct, that's what they finally figured out actually was causing my what they diagnosed me with was reoccurring acute pancreatitis, and they couldn't figure out what was triggering it. Well, they found I had a 14 millimeter polyp on my pancreatical, or my pancreas. Oh, there it is. The pancreatic duct, you know, where the stomach meets, you know, the duct sort of part. And they never found it. Just as a FYI, and make this video even longer, is even with a colon, like when you get a colonoscopy, the camera is on the end. When you get an upper GI, the camera is on an end. And they finally decided, hey, let's do an ERCP. And I don't remember what that stands for. And I'm going to look that up later, maybe mention it later. But there for a while, I mean, when they found they did the ERCP, found the 14 millimeter polyp on my duct. And in the I think it was March of whatever year it was. So I don't have to think about it. I had 4 upper GIs because 4 ERCPs for this. So, because they couldn't get it all. It took so long. You know, they go in there and they're not even working with their hands, obviously. But they ended up burning it off, cutting it off. They have it's like a little snare, you know, sort of thing. They make sure that there's no bleeding, and then they end up putting a stent in there. And and what's weird is I could feel it was in there. But once they're disposable, basically, meaning that they don't have to go back in to get it, hopefully, but it'll pass, you know, on its own. Generally within 2 weeks. So then you go in and get an x-ray to see where it is. For some reason, you know, the first 2 or 3 times they did this with me, and this is after the 4, you know, upper ERCPs that I had in March of whatever year it was. The very last one's when they put the stent in, I guess is what I'm talking about. But every time, the 3 times after that when they kept going back in there, because I was going every 3 months at that point, because they're so worried about this turning into or metastasizing. So that was fun. So then I had to keep going to get x-rays until it finally passed, because what happens is, depending on where it stops, if it doesn't pass, they can't reach it because it's too far away with the ERCP thing. And a colonoscopy doesn't go up as far as a flexoid scope or whatever that's called, which is a little bit smaller of a I guess a tube and camera and whatever else they use, but it could actually not be able to get to it or reach it. So you have surgery, they'll cut you like fillet you like a fish, literally, and have to get in there for it. You'd think it'd be just a little snip, but yeah, it's from what the doctor was telling me, and he finally passed. So I was like, woohoo, stomach polyps, DTs like we're talking about right now, got PT cancer, liver cancer, whatever the medulla blastoma is, rectal polyps. So there's all kinds, and really the test is easy. And I think now they're even doing a swab test, but I the first time I did it, I've actually been genetically tested twice, back in 2005. And it was a blood test. Then when I started going to Simon's Cancer Center, they wanted to redo it because the information out there has grown, and I had this maybe 3 years ago. They redid it, found more information, helped even more. But that was a swab for me. I mean, the genetic test itself is no big deal. It doesn't hurt. Unless no one likes needles, but a blood test or a swab to see if you've got this is well worth it, in my opinion. Yeah, a lot of this is lifelong, and for me, I will always have to go to a doctor till the day I die for and have CAT scans. And like right now, some of the stuff related to like the chemo, like my kidney and my liver problems, and even heart, will be monitored the rest of my life. Because when I went through chemo, I actually ended up with sclerosis of the liver, an F4. There's like 4 grades, I believe, or 5, like 0, 1, 2, 3, 4. I ended up getting to a 4. My kidneys were kind of a renal failure, and that's why they shut down chemo on me and went to the pill. But they gave me like 6 months or so my body can recover a little bit, gain some strength, and then be able to do this again. And if I went through the same thing ever with the Nexavar, they'd probably do the same thing. I talked about surgery, not very fun, screening. Definitely. The one thing I'll say, it's probably in here, but like with the genetic testing, and I think I've already said this, but I want to stress this, if you've got DTs or even FAP, which turns into either one of the other varieties of it, like the Gardner syndrome and the two-cock, definitely get your kids screened. Genetic testing doesn't help the person who already has it. You've got it. It's not going to go away. It will. I mean, if it comes back that you have FAP and that's why you've got it, for me at least, it was peace of mind. At least I knew why I got it, opposed to the ones that have it and are thinking, well, was it because of surgery or trauma or some other thing they haven't figured out thing. But then testing your kids, I think instead of a 20 or whatever it is. Oh, wait. We recommended yearly. Yeah, colonoscopy starting at age 10. And I don't know if there's people out there going to be freaking out, but thing is, knowing that you have it, if your kid gets tested for it, has it, definitely, just because they have FAP doesn't mean they're going to have polyps right then and there, I guess, or maybe, but definitely get a colonoscopy because you don't want your kid to go through that. And then if, like in my example, I am one of 3, I'm the oldest, I have it. My brother and sister didn't get tested for it, but chances are they don't, just based on some of the symptoms, or if they do, it's dormant sort of thing. Because you don't take the genetic test. It's not like you take a blood test and you go, an hour later in the ER, it's like, oh yeah, you've got it. No, it's they send this away. It's the same process as, DNA testing almost, just a little bit more intense, I think. This is just some of the stuff you go through. Like I said, well, the upper GI, I've had, matter of fact, I'm getting ready to go in for my 2-year thyroid ultrasound. I have an ultrasound, what I call it's the thumper test for my liver, where they actually, this is how they found out that I had any, the cirrhosis, is that they literally, and it is a little bit uncomfortable, and I'm glad they do. And if they would do it on the side where my tumor was, I think it'd be even more uncomfortable, but they can do it on either side, or no, actually they can't, because the liver's, anyway. But they push on your liver, they move it around a little bit just to get it. And I don't know if you've ever had even just like to look for blood clots or something like that. That's kind of uncomfortable too. But you got to realize there's ribs there, so it can be a little uncomfortable. I'm not gonna lie that it's nothing, but it's not overwhelmingly like you're gonna cry. Because I was worried about this test, and literally there was like a 14 or 15-year-old kid, boy, that just had it done, and I mean he came out laughing. I'm thinking, okay, I can do that if he can. And I mentioned the CAT scans, MRIs, which out of all the testing, I know this sounds kind of weird. Out of everything I've went through, MRIs for me are the worst, because unlike most CAT scans, you're in MRIs for hours. And the problem with me is, with all the scar tissue I have from this, not only from the 4 surgeries that I had, where I'm literally filleted from my sternum almost to Mr. Happy, to not get graphic. It's all scar tissue, and it was on top of each other. But there's also the scar tissue of where the tumor was itself. There's scar tissue caused by the radiation. So there's a lot of things going on. And, I've had some people, we've talked about this, even in my real life, feel sorry for me. I don't. I literally have it easy compared to most people. And I do live by the mantra that, it could always be worse, because it can. And it has gotten worse at times and gotten better. And like I said, it's all part of that roller coaster. And even if, and this is from my personal experience and advice, I guess for someone that is a DT warrior, mental health is a big issue. And that's why that's such a big thing with me. I don't take a lot of my own advice, but I know my triggers. I know my red flags when I need to, and I'm about there. Not that I'm, like want to hurt myself, or just, I guess maybe more just to vent or talk to somebody. There for a while, I helped run once I really was into my journey, and it was in a good spot for me, was helping with a Desmoid Tumor online support group. And I may jump back into that just for my own good, just to say hey to the whole gang, because there are still several there that are there still doing it. And I do get called from time to time to get on it and do my story and my testimony, with them, and answer a lot of questions. Because really, for me, when I first went through this, and I think I already said this, sorry for repeating, but I was like, why me? Why me? Not why did I have, well, I guess for me, I never went through the why me with the terminal cancer thing. I literally blew that off. And I said this earlier, that I handled not knowing what it was worse than I did thinking I was dying, because I even told my mom, and I don't hardly ever yell at my mom, because she wouldn't tell me what was going on when I woke up, because things just didn't add up. And for some reason, I flat out said, if I'm going to die, I have a reason, and finally she said, you've got terminal cancer, you 3 to 6 months to live. And I said, okay, and at least now I know what I'm fighting. I'm not going to give up, so, that's just my attitude. But yeah, not knowing was even harder, because it's like, how do you fight something you don't know what it is? So here you go. Cleveland Clinic. Oh, great place too. I guess this is the one from their site. I thought, this is for the FAP. That's why. No, Gardner syndrome, hopefully quicker. I should have just broke this into 2 segments. Made it 2 parts, but I'm not that smart. Sorry, Jimmy the Tux, that I missed you. I'm not even paying attention to chat, so I don't get too sidetracked. Just long-winded. I thought it said it was 2 hours. Ooh, hour and 20 minutes so far. So sorry. Once again, Gardner syndrome. It's a rare inherited disorder. stemming from FAP. So that's why I said I have both. Really, if you look at that's, and forever that kind of confused me, because like anybody that goes to a doctor, like when you get your papers, it'll say like symptoms or what you've been treated for, diagnosed with. I've got all pages and pages of things, and part of it was like FAP. Then they have it as like whatever the one like whatever it stands for that I can't pronounce. Then the Gardner syndrome. It's like, well, how can I have both? That makes no sense. But see, I forgot what this is. What's this? Gardner syndrome is a rare inherited. People with Gardner syndrome have unusual growth throughout their body, which is true. Not only the colon. This is what I was going to do when I was going to summarize this. But like up here, it says teeth and dental abnormalities, which I didn't know. I just, I read about the retina lesions, mouth, which I've got. If I remember what these are, because see, I've got which I thought was which it is, I guess, kind of, it's a calcium buildup. But see, I've got my jaw. Most people have their jaw, and right through here. Sorry, if I push down, I don't know if you can see that lump there. I thought it was like bone or cal, but I think what it is, it's a calcium thing that keeps growing, and it's almost usually most of it doesn't bother most people unless it gets big. But as big as mine's getting, it's starting to stretch the skin, I think, a little bit. So every once in a while, I get this, like that stretching, burning feeling there. But like what I'm worried about, if and when they take my teeth, if they're going to be able to get a set of dentures in there with this, and they're going to have to take it out. And the bad thing about it, not to gross people out, just being realistic here and get this information out there, that unless they've changed the procedure, is they will have to break my jaw, remove that, put the jaw together, however they do that to get rid of that. And that's why I haven't addressed that at all yet. I'm pushing that away as much as possible. But yeah, you can have cysts all over the place. I've got, and what's weird is, because when I told the doctor, when I finally found the one that treated it at the Simon Cancer Center, he asked if I had cysts, and I said, yeah. I said that they've gotten smaller over the years, but I know I've got one here, I've got one over here, that when I was a kid, they couldn't operate on because the nerve, they're afraid they're going to hit that and paralyze it. I've got one on my spine that they didn't want to go in to try to get, just because then I could be paralyzed. And then I had two, and I almost looked like growing up as a kid. I don't know if the scar's there, but you can still, the bump's still kind of there, the scar tissue. I got one on both sides that the doctors, back when I was a kid, even before this, took out. And like I said, I was telling my doctor this, and they took biopsies and said, well, what did they determine what it was? And I actually, to tell you the truth, I don't know if they ever sent them in for biopsies. Now that I think of it, because I was younger, I don't, they did it. I just went on, and what Mom said, they said it was ingrown hairs. Well, when I told my doctor this, he chuckled and laughed, and this is part of the misdiagnosis, especially way before I actually had. If like say somebody now was at a doctor that knew what was going on with the same condition that I had back then, they would have treated it totally different. But then, of course, I think I would have been part of that, every year, or the surveillance of this, so they can keep it under control. So that's part, and that's what's weird. I just thought of that, that was part of, like I was talking about earlier, being misdiagnosed can do much harm. Thank goodness it didn't do so much with me so much. I got lucky. But if not, like I said, if I didn't happen to get the acute pancreatitis, and then how they found out or worried about something like a lesion, they thought that was on a CAT scan. 6 months later, I could be in a world of hurt. I don't know how big that football-sized tumor would have been, what it possibly could have wrapped around then. And I actually got lucky that, my doctor said that it didn't attach to like my prostate, and I think I read that where which I do have trouble urinating, not to get personal, but we're talking about medical conditions. And I had and this just last year, a prostate cancer scare, literally. And I almost literally broke down mentally over this, because it's, it's like, and I might get teary eyed, and I sorry, sorry about that. And I'll get into, into that part when I talk about the chemo brain, because I wasn't ready for another battle. So, and I just happened to be, or no, I don't know what it was. My love her to death. Oh, my oncologist calls me personally at home. And I'm scared, because like I said, here they're telling me that they're worried I have a really enlarged, what did I say, prostate. So that's why that's like one of the first. Oh, no. The first sign was like, it's called a PSA test, and I'm not even going to say what that stands for, because some people might get offended. But well, no. Once again, PSA basically something about something. It's like semen in your blood or your cyst. No, it's in your blood, because that's how I got it. There's a normal range of 2 to 4 is like the normal range of whatever this PSA test that they performed. And this is before they even knew anything about. And I had a doctor call me, say, hey, I need you to come here to see me. It was a urologist, and I still go to the urologist. And told me what's going on. And basically he was like pussyfooting around. And, I told him, Dr. Andrews, if you're going to deal with me, you need to be straight. No matter how bad it is, I got to know, I want to know, type of person. I want to know what I got. I want to know what I got to, how I got to fight. I don't care about what my chances are, to be honest, because I said I'll beat it, guaranteed. I'm just that big of a butthole. Then, but anyway, this test came back with 51. It's the first, I guess, I hate to say trigger, the first warning sign, I guess, that somebody may have prostate cancer. Well, then they sent me in to do a CT scan. I don't think they did the MRI. They might have. I can't remember. I had so many tests, sorry, and so many, different things going on, plus the whole chemo brain thing. But yeah, it came back that, like I said, it was 51 versus supposedly 2 to 4. So they were pretty worried. Then they send me in just to have I think it was just a CAT scan, just to see the size. And then, like I said earlier, I had large organs anyway, a little bit back, even when they found this. And he said, you have a rather enlarged, prostate. He said there may be a good chance that you have prostate cancer. But anyway, like I said, when I was on the phone with my other doctor, and she knows, but we've got a really good relationship. It was funny because one of the nurses, the last time I was in it, just last month, because I am the same way in person that I am on here. And it's like most doctors love seeing me, most nurses, but it drives my mom nuts just because I don't know strangers. I just, there's just people friends I haven't met, sort of thing, or enemies, future enemies, whatever it may be. But, she said, oh, no, don't worry about him. He's my friend. So, she called me, but she knew I was upset. And she said, Ron, I'm not saying this isn't nothing to worry about, but, if you're going to get a cancer, get prostate cancer. It's really treatable. If it's caught, if it's, taken seriously, yada, 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 sort of thing, which reassured me. I mean, that's one thing. Hopefully you find a doctor that you're confident in, has a great bedside manner, and treat you as a human, not just a case study. I mean, just to tell you what kind of relationship I have with most of my doctors, if not all of them. I'm really about educating and talking about this. And I wish I would have done this earlier than some of the other crap I've done. But I just lost train of thought. Sorry. Oh my gosh. I hate this part. This is the part that I get pissed at myself. I should. I'm going to check okay. Hold on. There it is. Whatever the part of that story was. Sorry. I'll remember later, probably when it's too late, like an idiot. But this is just part of what I'm getting ready to talk to you about after the next of our sort of thing. But yeah. Oh, the other thing I was going to say about this, and this wasn't what I was thinking of, is, and there's the desmoid tumors, the polyps, is also, unless they're if that's what like skin tags are there, but there are cysts, like I said. But there's also, like with me, I've had some around my, both my eyes, that got kind of long that I've had cut off twice, and oh God, I hate that. But I've had a few in other places that just were irritating that they removed. But I'll always have skin tags. So, and I don't know if skin tags are exclusive to FAP or Gardner syndrome, or there's different reasons for it. So I'm not an expert on skin tags, but I do know that's why I probably have mine. Hold on. No, get out of there. Oh. Go. You're such a butt. Anyway, sorry, that's my dog. No. Excuse me for a second. I'm going to just shut the door. I should have done this before. Go on, Jack. Just for now. You're not in trouble. You're trying to get into stuff. Okay, sorry. So this is what I've got, which is rare. Obviously, as I mentioned, I'm trying to see if they actually give numbers of how many people get this, just to, it looks like there's a few more things on the list for, if you have Gardner syndrome. I mean, the other one had extra teeth. That could tell me what those are. Yeah, most of the things you can highlight, click. I don't want to make this too much longer. This, and this. Cysts under your skin. I've got those several places. Once again, that retinal pigment thing. Same thing, stomach cancer, liver cancer, colon cancer. It's, I'm not going to rehash stuff. Pretty much stuff there. Diagnosed for it. The genetic test. And I guess if you have polyps, I mean, maybe that's the one that I was thinking of. Sigmoid flexoid is what it is. What I had. I don't know if that's the same thing. Endoscopy, the colonoscopy, and the endoscopy is what the ERCP is. Like I said, I didn't know what the whole thing was. How it's treated, and I think it's really, it's like what side effects or what conditions you have because of that. Like, I mean, you're not going to treat a desmoid tumor just because you have Gardner syndrome if you don't have a desmoid tumor. Once again, if you have a tumor, this is what, some go through, but definitely monitoring, testing regularly. Let me see. Colonectomy. Oh yeah, this is what remove your colon or part of it. And honestly, I wish, like I said, they would have did a total on me, just so that. And back then, the only reason they said they kept the 6 or 7 inches was just the convenience of connecting it back together and not having to do more surgery to connect it further by, without any rectal, which I don't even know how they do that or what. But I have somebody else that I know that doesn't have what I've got, but just has stomach issues, that she had a total. And basically she said it, and not, I mean, I guess that is kind of, she jokes around and says she's got a bionic butt because of this. A proctal colectomy to remove your large intestine, which, thank goodness. I was going to get like I said, the Whipple test, and this is a Whipple test, the Whipple surgery, and this is kind of part of what got into that, but that doesn't remove it. It kind of takes some out and puts it back together and replumbs you with the Whipple. And I don't even remember what it was called, but most people, or like a lot of doctors using layman's terms, call it the Whipple procedure. You can't prevent Gardner syndrome. Either you have it or you don't. You can't cure it. It's a genetic, sort of thing. You can live a full life. Oh yeah, it's saying there. Yeah, I'm just answering from experience and what I've seen. Studies show 100% of people who had what are the, also. Oh wait, that depends, which it does. Gardner syndrome causes many different medical issues, some more serious than others. Left untreated, Gardner syndrome causes colon cancer, which I talked about earlier, which is almost 100% untreated. That may be life limiting, but surgery or removal of colon polyps may eliminate the risk of colon cancer. And like every time I go in for my colonoscopy, and because there's always something they're snaring. That's what it is. It's a snare. It's a heated snare. They burn it off. Send them in. If they look kind of mushy, they get kind of worried, and they really pay extra attention to it, and then take a biopsy, and that'll get sent in. So I actually get two different reports. I get one when I'm leaving with pictures of what the areas that they worked on and their diagnosis of it, and then I'll get another report of what the biopsies came back showing. If you're living with Gardner syndrome, you're living with the knowledge you're likely to develop colon cancer, which isn't fun. Just think about, it's a time bomb, literally, especially untreated, as I mentioned. Regular cancer screening tests and treatments help reduce your risk of developing cancer, just like any other cancer. Testing is definitely very, very important. Cancer in general is important to me. It touches. I've had, people in my family die from this, or not from this specifically, but from cancer. When should you contact a health provider? When you notice changes, especially major changes, and see, like with me, not to be gross, but my doctor instills in me, when you go to the bathroom, just a quick look for blood, and that happens quite frequently, especially, and not to get gross, but it's just part of it. I've also got what's called acute diarrhea. You don't have a colon, nothing can dry up, or doesn't dry up as easy. I have a lot of deficiencies as far as vitamins, minerals, even my medications I don't absorb as well because of it. But if you go to the bathroom a lot, and literally, and this is part of what was listed as putting me on disability, but just a very small percentage. But like, even when I worked, a typical day from say sun up to sundown, if I don't go to the bathroom, say, and I'm not talking urinating, 8 to 15 times a day, I'm not going once. So things get raw there. There's a difference between having like spotty blood and puddles of blood. So that's why, like, if I do see one day or one time, I double check, is it, I guess I just know the difference after a while. But yeah, I'm very concerned about that. And definitely, this is one thing I wasn't afforded the luxury of, knowing what to ask. I went totally with what the doctor said. And like I said earlier, with the 70% reoccurrence that I didn't know about, I would have probably still had the surgery, but at least then I would have known. Instead of, hey, we're going to get this, we took care of it, had radiation. And like I said, after the radiation, they left me on my own for 3 years, not them not knowing any better and me not knowing. So yeah, there's definitely, prepare yourself when you meet a doctor, and really any doctor, no matter what you have, definitely treatments, because there are several different ones and not just one. Ask for options if you end up with any condition. Ask if you depending on what it is, if you need surgery. And actually, I'd go further, if it's not even on here, find out the risks, not just if it's reoccurring, but of bleeding out, because there are just even the simplest surgeries, there's complications. People die of things you would never think of from the surgery part of it. Not the surgery went on just because it happens. But definitely educate yourself on the risks of any surgery, or actually any procedure, if it's nothing, something that's that worries you. If you have a concern, your doctor is there to answer these questions. And if you have a doctor, I'm not saying all doctors do this by any means, but if you have a doctor that doesn't like to answer it, I'd actually kind of try to find another one. And if you've got DTs, it's even harder. And I know, maybe a doctor that doesn't answer questions is better than, or, that knows about DTs is better than one that answers questions but doesn't know about DTs. Also, ask them what kind of tests you're going to have to go through, not just this time, but, for the rest of your life, and other ones that might be possibly pop up. Are there changes in my body I should monitoring? Absolutely, yes. And like I say for some reason you don't have, skin tags or a cyst or, a lump somewhere, I'd be concerned, especially if you have got FAP or, Gardner syndrome. Definitely. So, and I'm talking about when you first go at it, but, most of these are still the same thing. And then I kind of got into this, but definitely ask your doctor. And that would be a clue for me, kind of, if he says, well, nah, just don't worry about it. No, definitely. And I don't think there would be a doctor out there that would say that, but I'm just saying if. That would be a red flag for me. And I think that's about all for Gardner syndrome. Oh, my goodness. I'm getting close. Hopefully. There we go. Okay. No, whoever's in chat, hey, how you doing? Sorry, I'm not trying to ignore anybody. I'm just trying to go through this. And maybe if you're going to still be here for a few minutes, I'm going to get into the, oh, gosh. Come on. The pages. I'm an idiot. The Nexivar, and this is what I was talking about. That's sorafenib, but I use Nexivar because it's easier. And obviously, if you're watching any of this video and you're made it this far, yeah, I can't even spell that probably. And really, I want to get into just some of the side effects. I'm not going to get into dosages or usages. You can look that up, and I think I mentioned this, but I have all the pages that I've used and even a few more listed in the description, and for some reason it didn't cut and paste right, so I'm dumb or whatever the case might have been, so I haven't fixed it, but you're gonna have to cut and paste it in there, to get there, sort of thing. But just real quick, Nexivar is a brand name prescription medication that used to treat certain types of liver, kidney, and thyroid cancers in adults. And that's one thing I've learned, and maybe other people have through other drugs and other conditions. There's a lot of drugs that were tried or were trying, were made for, say, a specific thing. As it's used, I'm talking about the drugs that were FDA approved and, doctors have used it. All of a sudden they found out, oh, not only can I use it for, like say Nexivar was used just for liver. Well, all of a sudden they found out, well, not only does it help the liver, it helps the kidneys and thyroid cancer patients. And now, DT patients. I'm not getting into all this kind of stuff. That's about liver cancer, kidney cancer, the thyroid. It's kind of funny that the DTs ain't listed. I know lots of people on Nexivar. Nexivar is available. Oh no, this must be an old one then, because I thought Nexivar or the sorafenib was the generic. Maybe not. Wait. Nexivar contains this active drug, sorafenib. Okay, maybe that's why it's called that. Okay, maybe there isn't a generic of it. My bad. Never get real quick. Not really quick. So much, but like some of the side effects of the drug that I am taking. So if you're here looking for answers and you are on Nexivar or trying to find information out about Nexivar or how Nexivar works for other people, this is the part you might want to kind of like really look into, because this is just when I've got a folder just of DT stuff, and I've got like probably 4 or 5 drug websites that I use. And me personally, not that I want to be safe than sorry. So if I got to read the same stuff on 3 different sites, then I feel more confident than if I read 3 sites or 4 sites or whatever it is, and they all kind of differ on, at least the important stuff. Nexivar can cause mild or serious conditions. The following list contains some of the key side effects that may occur while taking Nexavar. And the one that I want to talk about, the chemo brain, which might just be, a generic term. I don't even know. On this one, I don't think, but the other day I was talking to this with 3 gentlemen, and one of them found one that said that the side effect that I really want to get into when I get into the chemo is that something about losing focus and here I'm going to do it, and forgetfulness is the side effect. And I go through that a lot and was actually accused of faking this, which, I'm not one to care what people think per se, but it's a real thing. I even got a shirt that says, I have chemo brain. What's your excuse? And I've actually got and I might put it on her, towards the end of this, just to show you that I've got an avatar that says I've got chemo brain. I don't use it because somebody that I talk to, not that she's offended by it, it makes her sad. So I don't use it when, she's around, but once in a while I'll pop it on there, especially if somebody's, telling me, oh, you're an idiot. You can't remember anything. But the mild side effects can include infections, which I do deal with a lot. The respiratory, I make sure I get all the vaccinations I can. And even then, at times, it doesn't help because I went through a thing 2 years ago, just to give an example, that from like October to February, I was constantly coughing, sneezing, runny nose, and I had no clue what was going on, and found out when I went back for my follow-up that, it could be part of the drug sort of thing. But I had, I thought it was just hay fever, or then it kind of morphed into a cold. I have a flu shot, but still got the flu. Ended up getting COVID. I get the COVID vaccination. Once I recovered from all of that, I ended up with, and I know there was something in there before the last one. Oh, well, whatever, something else related to that. And then I ended up with walking pneumonia. And that's when I found, I didn't even know walking pneumonia is contagious, and I did not know that it was. But all of this, and I mean, literally, I was constantly, I'd go through boxes of tissues all the time, wake up in the middle of the night. So I do have problems, with that. But now I think with a new a pill on top of what I take, it's really helped it. I got lucky because that's what I know, I'm so vain. I was worrying about losing my hair. I'm almost 60 years old, and I was worried about losing my hair. But I didn't have hair loss. I didn't have balding. I didn't have thinness. None of that. I'm still on Nexavar. As you can tell, I've got a full head of hair. And no, I don't dye my hair. I don't know if the gray show up or not, but I've been accused of dyeing my hair, and I don't. But nausea and vomiting, definitely. But I have, and I can't say that necessarily causes it. I had that before, like I told you, from 2009 until even now, even though I don't go through the 2 hour, the cycle that I was talking about, and purging things, not being able to eat anything and going to the ER for a while. And it just happened. I do a trivia show for those that, don't know. I was doing it on, Wednesday night, and I couldn't do it because I ended up going to the ER to get my fluids. And like I said, the pain shot and a, something for the nausea. And then I was fine. I was on I was in there forever, because if anybody that's had even just one bag of fluids knows it takes a while for it, hours, for it. And I went through like a bag and a half just to tell you kind of how long I was there. But for me, it's well worth it, because I was there. They gave me pain medication anytime I needed. I was actually sleeping through most of it once I felt better. And they shut the lights off for me, gave me even an extra warm blanket. I love that. If you ever go to the ER and they don't have a blanket warmer, tell them they need to get one. That is probably the best thing ever, other than, the life-saving stuff. It can cause abdominal pain, which happens, and see what for me, it's like you read your medications, and a lot of them have the same sort of kind of, things, well, you're taking say like a nausea medicine. Oh, this may cause nausea, but that's pretty much, straight across the board because of the study. So for me, I have problems. What is the desmoid tumor? What is, the medication? And if it is a medication, which medication or what combinations of medications? Another thing I deal with which isn't the next one. I'm talking about the medications in general. And this is, doesn't help the focus is I take 120 Vicodin a month. I could not live without them. That's from the heart. That's, gospel. And they wanted me to go on, what's the other one? Percocets. I refuse to go on Percocets. I don't feel that and that it may sound strange, but at least I'm not strongly addicted to Vicodin if I am. And the reason I say this is there were times I got so frustrated with my old doctors before I found the one that had treated this, that I stopped taking all my medications, which literally was hell, because everything that came up, or the reasons I was taking most of them, intensified. But to me, it was well worth it. Anywhere from I know on 3 occasions I've done this, anywhere from like 2 weeks up to, a month, where I'll stop all my medications, start taking the ones that I think I really, really need, and see if it changes and start, does, especially with the nausea, they were telling me that one of my medications was causing nausea, but they didn't know which one. And this is the first time, and this is how I got the idea. It may not be medically safe, but for me, I had to do it because it drives me nuts. And, but during all 3 times, the last pill that I took, again, even if I discovered what I think the problem of the pill was, I still took the painkiller last. And with saying that, if you've taken, Vicodin for years, and of course keeps increasing, you need more and more for either getting used to the drug itself, or, things have escalated with whatever you're taking it for. But I never went through withdrawals. I never oh my God, I got to take something. I need to, so I know I'm not addicted to it, or at least I don't feel that I am. And then, and all 3 times that I've done this, the painkiller never once, it, was the reason behind it, or at least by that process. That was as scientific as I could get it in trying to determine this. If you've lived, like with me, I've lived with nausea during most of my journey through this. Part of that with not even knowing what it was, why I had it. But then, especially when 2009, when the tumor came back, it's, when you don't feel like eating, even if you want to eat, you want to, smells trigger, nausea, even vomiting at times. Are used to. It hasn't for a while, thank goodness. But anyway, I had, which I don't have high blood pressure. I ended up finding out I had what's called a hypertensive heart. Went to a heart doctor, put me on 2 different pills, and one's they call it a water pill, but really, he said, this is a salt pill. And then they put me on cardio, whatever, something. I could look it up, and I can't pronounce it. I'd have to spell it out, but it's a hypertensive medicine, and it took care of it. Because the problem was, when I had back-to-back blood infections, I asked to do rehab because I was so weak, and I just couldn't, no matter what I did, didn't seem like it was working to help me. But I started sweating real bad just over the simplest things. So I made it through there, went to my second one, and the therapist, and was nice, really concerned. She said, do you mind if I take, your blood pressure and your pulse before we start? And it's yeah. And she goes, do you realize that your pulse is at 120 at rest? And I said, yeah. I said, I see that all the time, and nobody's really ever said anything to worry about it. And she said, okay, I'm just, but then we would stop after every little thing. And I'm talking about I guess just to visualize it for you, you grab the back of the chair and you just raise up on your toes, back down, toes, maybe 3 sets of 10. Well, then she took my pulse because she wasn't so much worried about my blood pressure because it was good. It was the heart rate. And I was already up to 140. And this went on for 2 or 3 more exercises, very little, effort, I thought. And she finally stopped. She said, you're at 190. Now I can be pretty active, and my normal heart rate or pulse now is 89. and even doing exercises, if I'm above 110, that would be high, for me. So definitely, even if you have issues that may not be related to this, get it taken care of, sort of thing. I guess I'm doing like 5 different medical things at once. So mild effects that can also include, which are explained in the side effect details section. Fatigue, and this is what I mentioned the other night to somebody. It's called hand and foot disease, but they're saying reaction, where it's a condition that causes redness, itching, or peeling of the skin on your hands and feet. And actually, for me to be more accurate, unless they have a better one, whatever what they say in the side effect section, is it could be anywhere from, no symptoms at all, taking this, to just a little bit of redness, to like maybe mild itching, all the way up to major blisters. And I think maybe that's what they're talking about, peeling of the skin. You actually can get blisters. If it even starts, they want you to stop the drug and then call it, the doctor right away, because that is, yeah. And thank goodness, the worst I've got too is minor blisters on my feet. But what really, really helps is, and what's funny is when this new company, this On Call 360, sent me my first shipment of the Nexibar, they have a little care package, and I thought that was so cool. But in this thing, they had hand sanitizer, they had lip balm, they had, maybe I'll think of what the fourth thing was because I can't remember. But then they also included, I think it's, when I just had it, I don't know where I seen it, but yeah, it's up there. I think it's that Udder hand lotion or foot, whatever it is to use. So I started using it, and it actually helped that. But there's other things you can do for it, but I've never had much problem with this per se. I haven't had a skin rash. See, I've had decreased appetite, but I take so many other medications, and just my condition. I mean, if you're nauseous, you're not going to feel like you're eating. So that's where I have problems, where the overlap, which thing is causing what sort of thing. And even for my doctor, even they say this is, it gets frustrating. And then obviously the diarrhea, but then it doesn't matter because I don't have any colon. So I'm already diagnosed with acute, diarrhea. I'm trying to look for some of the, like the serious ones, just like any other drugs, chest pains, trouble breathing, fast heartbeat, dizziness, swelling. Every time I go in the doctor, they really worry about anemia, which is swelling, and definitely that, they always check my ankles for sure. Severe skin reactions. And I think this is what the hand and foot is actually called. I think the Steven-Johnson syndrome, the redness, pain, swelling, blistering of your skin, and peeling. Okay. So it's just that there are 2 separate things. It's just that in the details, they went a little bit, thing. And this is one thing my doctor, this is part of why I check my stool after that. I'm looking, actually I thought this was the one where the bleeding sort of thing, but yeah. And once again, no, I have this automatically. I've got this from scar tissue, radiation, yada, yada, yada. They check for jaundice, but they even do this with, like I said, the other chemo. And I don't know if I mentioned this, but like when I did my infusions, just to tell you, because if anybody's been infused, this is usually the combination for a lot of them. I don't know how prevalent it is, but I've heard of a lot of people, and I'd be sitting there talking to somebody that's going through an infusion. Because even if you're going through, getting infused, if you've ever been into a hospital, had surgery, an overnight stay, and had an IV hooked up to you, and you were able to move around, what I call the girlfriend, is that pole that has your fluids. It has that machine to, regulate the flow of medication. You'll have a pain pump, so you can get up if you're able to, grab a hold of that and you walk around with it. So yeah, when you get infused, it's the same thing. It's not like you're stuck in that chair per se, but a lot of people, especially if you've been doing it for a while and you're deep into a round of chemo, don't get around it much. But this one lady that I struck a friendship up with, and this one, who just passed away recently, but she didn't have desmoid tumor. It was a different, kind of cancer sort of thing. But I could just tell she was having a rough time of it, and she was there by herself. I mean, there was somebody with her. They left to go get something to eat, and some people literally do 8-hour drips, 5 or 6 days a week. One lady that I was in there with talking to, she had stopped me, and which blows my mind after hearing her, her story. But she stopped me and she said, "Sir, you got time to talk?" And this is when I was getting ready to leave. I said, "Yeah, no problem." I'm thinking she's going to, ask me something, that she's a newbie or what have you. And I'm all about educating that, about this stuff. But she said, "Yeah, you're an inspiration to me." And I said, "What the hell are you talking about, lady?" Not like that, but it's like, no, why? She said, "Because I'm sitting here, I'm feeling down, feeling sorry for myself." She said, "I've had, chemo starting, I think it was like 18 or 20, years prior to that. And now she does, I can't remember if she said once a week, once a month, she does just one session of it." But she said, which still isn't very, pleasant. Any toxins that you put in your body isn't fun. But she said, "No, I'm sitting here, feeling sorry for myself or having a bad day. And I hear you over there talking to people, laughing, being positive, and, and then I saw you walking around, talking to other patients, and she said, you don't see that a lot here." And I said, "Well, I'm not," I said, "I guess I actually live by two mantras." I said, the first one is, it can always be worse. And it can, especially with the roller coaster life. And I said, the second one is that, I have cancer. Cancer doesn't have me. I said, it may kill me. It might be the end of me, but I'm not going to be a victim of this. And all of a sudden I seen this smile on her face, and, so we ended up with a friendship. So every time I was there, and generally, just like with radiation, and even with some people, when I go in, because I try to get scheduled the same time every 3 months, I'll see the same people. Same thing with, like I said, radiation, you schedule about the same time, usually the same thing with chemo. So, but even though she was only going, like, I think it was once a month, if I remember right. When I would see her, me and this other girl that was there, Janice, we would come over, and we would, and it almost become like a impromptu support group without being a support group sort of thing. So for me, that felt really good inside. But no, I don't see myself being an inspiration like that, because I look around, and this is part of what my story is. When I first started radiation, the first day you go in, they put this thing down that you have to lay on. I think it's got foam in it, or they pump foam in it, and it forms around your body. So this way it helps them, put the radiation where they need to with less risk. Plus, I've also got 3 little dots on me that are actually tattoos. I could probably find them if I looked really hard for them, but they're so small you can't hardly see them. And then with that being since 2009, I'm not even sure, they'd be very, popping, if that makes any sense, sort of thing. But there was a guy there in a wheelchair, come to find out, because he struck up a conversation. And I guess maybe that's where I got why I do what I do of walking around when I was infusing. But, he came over to me in a wheelchair, just found out that, he's going through radiation, going through chemo, just had part of his lung removed, getting ready to get more of his lung removed. And basically he come over to me and with us, and he always had a smile, and he did this with all the new people, or at least the ones he thought were new. And I actually ended up, pushing him around. His caretaker was with him, and I'd tell her, if you want, go get some drink, go eat, take a break. I'll push him around. We'll do our welcome wagon calls, as I called it back then. So that's part of the reason I have my mantra of, it can always be worse. Because if that guy can go through what he went through with a smile and still want to help people, I have no right to bitch and moan about myself. But anyway, sorry, I got on a tangent. I do that a lot. And here are just some of the other quick, side effects. Skin rat, same thing. I'm just seeing if it's talking about like foggy brain sort of stuff. But a lot of these aren't real common. That is more common than I thought it was. Wait, Yeah, 21 to 69% of people taking XFAR develop this. And I guess so. It just depends to what degree, I guess. Because down here it's saying like 6% to 19% have serious reactions. I just have a more mild one. So I can't, do that. But definitely, like for every symptom, your doctor can give you either a medication, tell you how to take care of it, get rid of it. That sort of thing. I'm gonna check chat real quick. Sorry if anybody's in here, which I doubt. Okay. Hey Gigi, sorry bud, I missed you. But this is kind of like important to me. That's why everybody keeps leaving me, because I'm not focusing on them. I'll be done in a little bit. I'll be over there to hang out with you guys. All right, so back to this. And really, the only thing I've got left, if you're still here, going through this, is the chemo brain and the interview that I did through the Facebook group years and years ago. But it's already up there. Chemo brain. What is chemo brain? And this isn't exclusive to desmoid tumors. This is prolific. Oh, the last thing, one more thing about medications. That's how it got me on my tangent was and this is a prime example of chemo. I'll be talking about something, especially get on a tangent or even have a pause and I'll forget exactly where I'm at. And, it's like, okay, what was I talking about? Usually it'll come back or somebody will say something to trigger it. And it's like, oh yeah, this is what I got to say. So like when I'm doing streams, sometimes it seems like I'm rude or whatever, but it's like, if I don't say what I'm going to say, I'm going to forget again. Well, and this is part of what someone suggested, which I can't see the screen, by the way. Have a notepad, have a pen there. If you got a question or you want to say something, write it down. Just take a quick, jot a note down, something like that sort of thing. So this is how bad it is for me at times. And and there's other factors, not only medication with chemo brain, and it'll get into some of this. But chemo brain can help you fight therapy. Chemotherapy, it does obviously help fight cancer, but side effects are almost certain. It's common for you to have a cloudy mind, there we go, called chemo brain, during and after treatment. Maybe you have a hard time remembering names or can't multitask because you used to, and I definitely can't. As many as 3 out of 4 people with cancer say they're not as mentally sharp. It's often caused, by chemotherapy medications, but it can also come from the cancer itself. I didn't know that necessarily. You learn something, or reminded, I guess. And this is part of what I wanted to do, to get this back in my mind and quit being selfish and get back to trying to help other people with, any way that I can, for any sort of, thing like this. But big thing is, infections. Like I said earlier, I had back-to-back infections, but low blood counts, fatigue. I have problems sleeping. I had insomnia before I had the DT, which goes back to me being bipolar or stress. Definitely, I would agree with every single one of those and probably add more if I could think of them. Chemo brain can cause thinking and memory problems. Symptoms include concentration and paying attention. And this is like, this one especially, at times I feel people think I have either I'm not making fun of it. My son is diagnosed ADD and ADHD. I can't believe I actually remember what the letters were on the last one. And it was diagnosed bipolar. And his psychiatrist said, well, if you're bipolar, and it's not like bipolar, there's a blood test and say, yep, you are. It's a diagnosis. Chances are, your dad had it too, which actually I went in, broke, my pride. And that's a whole different subject, I guess. But I went in there and talked to the guy. And once we started talking, he gave me this list of things, and it had like 15 things. And it was like, I think the answers were yes, some, maybe, or sometimes, or no, or however it was. Or don't know, or whatever it was. And like one of the questions would be like, if when you're laying in bed, does it seem like you can't shut your brain off? Which that's me. Yes, no, or, maybe. It's like, yeah, definitely yes, boom. But there's other ones, because I'm very analytical. I over analyze stuff. And so when it says, well, do you have mood swings? Well, if I stub my toe in the middle of the night, hell yeah, I'm going to get pissed off, that sort of thing. So it was like I was trying, and I do minimize a lot. See, the way I'll mention just slightly, my sperm donor was the type that real men don't cry, real men don't help, or don't ask for help, rub dirt on it, walk it off type of thing. And you definitely don't share your feelings, that's, and I'm still to this day dealing with some of that. But when people talk to me, sometimes they think that, oh, you have ADD, whatever it is. I just did it. Or something else that's causing it. And it's like, well, no, actually, I wasn't this bad at losing concentration because of, being bipolar or what have you, sort of thing. But so, yeah, I definitely have that one, which to me still, it falls into the same, next, I guess they all tie together, remembering names, dates, and everyday things. And if you've noticed, I've had trouble remembering what day, certain things have happened, and I need to actually go back and write stuff down, I guess, and make a timeline for myself. Finding the right word or doing simple math, like balancing your checkbook. And see, this is, oh my goodness, this is so funny, because last night, I wasn't even going to mention this, but earlier when I was talking, 5 out of 6 people per million, and if the population's 335 million, I had a hard time trying to figure out how many people that was, literally. And that's why I said earlier, I'm not going to get my calculator, none of that out, figure that out. And if anybody comes up with an answer, tells me before me, to be honest, because I couldn't give you a number right now. I kept coming up with these really weird numbers. And it's like, how the heck, sort of thing. So I do have trouble at times doing, simple things that require thinking, whether it's math or, I used to debate a lot or talk, have conversations, and and I still do to a point, but I don't debate anymore because I don't have the concentration power to be able to do a back and forth. And to be honest, I'm really an intelligent person, but if I were to get on to YouTube, to debate somebody, I can get into a discussion, but to do a debate, no way. I just don't have what it takes anymore. And I used to be a great debater. I think this has to do with the multitasking, doing more than one thing at a time. And that's definitely me. I watch a lot of channels on, say, just even YouTube, and I cannot multitask, whereas I am trying to follow 2 or 3 or 4, say, chats going on in different rooms and keep up with them. While we're back in the day, I could do that all day long, and now it's just and mood swings. But for me, like I said, I don't know if that's from the medication or from being bipolar, because that is one a symptom of being bipolar. So it's like everything I've got, once again, everything seems to overlap somehow. So then, maybe you can feel or figure out how. I mean, I've got my oncologist, I've got a heart doctor, liver doctor. I'm trying to look at my body and not have to think about it. Wait, I said liver, heart, kidney. I've got a pancreatic doctor who is a GI doctor who does the upper part. I have another GI doctor, or don't. I have a GI doctor that does the ERCP. Then I have another GI doctor in the same office, but they specialize in different things, that does the upper and lower GIs. Well, then, like I said, I've got a urologist. I know I've got an infectious disease doctor that I still see. He's the one that was responsible for the the blood infection, the back-to-back blood infections that I got from the chemo. And you know what? Speaking of chemo, because I just remembered another thing, because I was talking about my infusion, or did I even mention that? I can't remember. But I was on methotrexate, or however you pronounce it, and Visibin, which are very common, drugs. So if I mentioned that earlier, fine, but I can't remember. But that's what I started off with my infusion, or actually my infusions, that caused my body to break down so bad. But anyway, if you're in a mental fog, talk to your, medical provider. They will ask about your symptoms. They will also want to know when your problem started. And for me, kind of going back to the earlier stuff, like when they're talking about the causes, I have chemo brain every day of my life. There's no way around that. But very rarely, is it to like so bad that I can't, or I feel embarrassed by it. Like right now, I kind of feel embarrassed by all the, the times, and that's what I was kind of worried about. But, I just got to learn how to blow that off and keep going. It's just part of, it's not who I am. It's just what I have, I guess, sort of thing. I just forgot what my point of that was. Anyway, sorry. Oh, I remember that. But it's also really affected by sleep. I'm so bad right now because the last 3 or 4 nights, I think I said earlier, because I do suffer from insomnia anyway, but I haven't slept very well. Last night, I finally got good sleep, but I'm still dragging. You don't ever catch up on it. It just finally works out somehow, some way. So, that definitely affects if you're sick. I'm trying to remember what some of the, if they had that up here, what the causes of it, sleep or something. Oh, here we go. Yeah. And really, I can't do nothing about the cancer per se. If I've got an infection, I can take care of that, but I can't per se stop it. I can minimize it. Yeah. And my blood counts, all my things do a roller coaster thing. Like I said, I have many deficiencies in vitamins and minerals, yada, yada, yada. But definitely sleeping or even stress can affect that even more. Oh, sorry about that. But yeah, if you're going through this now and you can relate, then I'm glad, and hopefully, helps you realize you're not the only one that goes through this. There is help for it. And really recognizing the problem is half the half the battle, in my opinion. But definitely, and I'll probably say this 100 times. I don't think I have yet, but make sure you have a great support team, not just from your medical community, but people in your real life. And I'm not discounting, say online relations, because I've got a buddy in Canada that I've known for years that we game, and he just lost his mother a few weeks ago. So I care about them, don't get me wrong, but they're not there seeing what you're going through, and they can only mentally, try to figure out or see what you go through. Whereas if somebody in your real life, like my mom, or, actually both my parents, my dad passed away almost 2 years coming up on the 22nd here. My son, I've got a grandson that I focus on. I really do. And I'm going to focus even more on that little guy. Not that he can necessarily help or knows what's going on, but just being around him, for the happiness factor, find something that makes you happy. And I'm still doing that outside of my grandson, to be honest. I have things I like to do. Don't get it. And I've got a puppy that I was forced upon, but I love him to death now, and I won't give him up for anything. If anybody would ever pop into my trivia show, and I'm actually on camera, that's why it's part of the reason I had to shut the doors, because he wants to jump up here, and he's probably more famous than I am on YouTube, or more liked, put it that way. And it's funny because the people have gotten to the point that are like in the side chat of trivia that I do, every time he goes by, up jackass, and that's hence the name of the show. It's like, you don't know Jack, and in parentheses Black, and that's what I named my dog, was Jack Black. And pets, even before I got him, I had an orange striped cat that I could have had the worst day or had an awful session at the hospital or the doctors, and walk in and see her, plop down, put a little bit of a smile on my face. But it was when she came over and would snuggle me, like she knew something was going on, or that I needed, a hug, at least in her version. Well, then she passed, and I had two cats at the time, her and the one I've got now. And so, at some point, you may see her walk around. She's a calico, and they live together, and they didn't like that too well. They're just they're very independent, both females, and very clingy to me. But and now, before I had the puppy, that's at night she would ball up, whether around my either side of my head or under my armpits, and now she usually does the opposite side of where the dog, because my puppy sleeps with me. Sorry. But and then she'll be on the other side, but she's kind of leery of the puppy still. And when I say puppy, he'll be a year old. His first birthday Sunday. So find something that helps you take your mind off of this. Something that you can just. It's not going to take anything away. I promise you. Sorry, but you have to have more than cancer or a disease of any sort in your life, and that's all you have. And see, my problem is just like YouTube. I get so invested and I take things so personal because I invest everything into it. And instead of being and I hate to use the word hobby, but for lack of a better term to contrast the two, but instead of being a quote unquote hobby, it turned into either a lifestyle or a commitment I didn't want. With a lifestyle or a commitment, you can't just walk away or just not or disregard what people think or say and not be personally hurt by it or whatever term there might be. Whereas what I'm doing now is making it more of a hobby, even though I have to, and I feel that I need to get stuff out like this. And it may not help anybody, but for me it does, because it's like, at least in my mind, there's the chance of somebody walking by and I've helped them. Just kind of like when I think I said earlier, I've got a great relationship with all my doctors. There is never a time where I have an appointment where I don't have at least one intern that the doctor wants me to talk to. And when I first started going to my liver doctor the first time, he had 5 interns that he specifically scheduled to be there so they could talk to me. Because, I mean, for those of you that are going through the Desmoid Tumor warrior thing, you know how unheard of it is. And if I can help anybody, I've had nurses come up to me and say, hey, can I ask you questions about this? I've had, the interns ask, because I not only do, like I said, I have all these things going on. I'm like probably a medical mess, a train wreck, to be honest. And if I can help somebody later down the road, educating doctors, nurses, anybody that might be involved in this, I am all for it. I mean, I'm actually, my plans after I die is to be cremated, put into a metal coffee can. Just, I don't know if anybody's ever seen the bucket list, not for the spoiler alert. You'll understand what I'm talking about. And that's why I kind of like the idea, sort of thing. But, and I'm losing my train of thought because my tangents. But I'm going to have my body donated to science research. If they can, look at my body or the tumor or how it grew or figure something out, or even add more data, than they have, I'm all for it, because I'm dead. I don't care what happens to my body, really. Just don't tell me about it, because I don't want to know if there's anything that I don't want to know about, sort of thing. But yeah, there are things, and with chemo brain, when it disrupts your life, I guess your doctor may suggest a counselor or a psychiatrist, which I do. I definitely, like I said, mental health is even mental health prevention is so important in this, because not only are you trying to physically fight something, there is an emotional toll. And to be honest, if you can find one that actually helps caretakers and families understand this, or because it's a toll on them too. I mean, imagine, I'll use my mom for an example. Here she sees her son that, at times can barely walk, that's been hospitalized. I don't know how many times over, this. I've had, been gutted like a fish 4 times, on and on and on, and like I said, she was the one that told me about my so-called terminal cancer diagnosis. Do you want to be, have your parents or family or whoever, your support group, go through this and not think that it affects them? It absolutely does. My problem is I mask way too much, even online, especially online at times. And then when I come unglued, whether I have a good reason to do it or not. So anybody that, maybe watch this, that that have seen streams, or, wonder why at times I do what I do, maybe this might help explain it. I'm not justifying it. I'm not using it for a reason or an excuse or whatever it might be called as a negative. This is my life. This is other people's lives, not just the DT community, not just cancer, per se. Because there are certain things that people do go through chemo for that aren't necessarily cancer even. Sometimes it's just even for some sort of prevention or sort of thing. But yeah, these are some of the things that I'm going to start doing for myself. I keep putting it on the back shelf and I can't, but there's one thing I will not do unless I have to, and that's take another pill. I take so many pills now, it's not funny. And to add another one and then to have some other possible side effects or side effects that can increase other side effects, it's risk reward, for me. I don't suggest that for anybody else. You're going to have to make that decision on your own. But literally, I think the other night I counted, I take 12 pills first thing in the morning. I take 6 pills before I go to bed. I've got 2 pills that I take 2 times a day. And then including the, morning and night is taking, for anybody, the Nexavar itself, I take 2 400 meg doses a day. So for me, it's like 2 pills morning, 2 at night. So not only am I on a pretty stout dose of it, I do it twice a day. So it's like I can't let my body take a break even during the day from this stuff. But there might be a point where I have to take or stop taking so much, where I might do like 400 megs a day. And generally, like my doctor said, which we've done this one time because they thought the chemo was starting to break my body down, or the chemo pill, sorry, Nexavar, where I went to just one dose at night, but it was 400, or not 400. Yeah, 400 twice a day. So it'd have been 2 pills at night and not the morning. So sometimes you adjust, but definitely exercise, get up, do stuff. Don't sit around, think about it. Or if you're going to think about it, help your body out. And this is where I'm at. I've been doing this for a while now, but my body was so broke down. And even now I still have problems with muscle strength and stamina, just to tell you how bad I am. Even simple tasks. And to me, I get so embarrassed, and I'm not a person that's shy. I'm not modest. It takes a lot to get me embarrassed. Ask anybody in my real life, they'll tell you. But like when you go to, say, Speedway, I don't know if wherever you're at, here we have Speedway that I usually go into to get my pop. So I'll get the cup, and you know how you pick it up, put it with ice, you push this and this, even just pushing the ice things. My hands start shaking in my buddy, because he knows I don't take offense to it. And I use laughter or humor a lot to deal with negatives, just like I had to learn to quit joking around about, basically being a dead man walking when I first started this, because I forgot to consider her feelings, sort of thing. So it's like at times I got to be careful. So, and I hope I don't offend anybody, by telling you this, but this is just, how my friend, who is part of my support group, really helps me out. But we go get to the car or something, and he'll say, "Oh, I seen that your Michael J. Fox kicked in." And at first I was kind of like, yeah, but then it's kind of like, okay. Or, some sort of, and I know that's probably offensive now that I said it out loud, kind of, but that's just, sometimes you have to laugh at things. But when it affects your life, definitely take care of it. Do the steps that you need. And definitely, and I even suggest this, if you're dealing with Nexavar, chemo of any sort, cancer, and probably any other disease, let's just lump all of them in there, always, definitely, you may not be tired, you might feel wore out, there's nothing wrong with laying down and even just resting, or even sitting in a lazy boy sit kickback. Doesn't mean you have to sleep, but sometimes rest is all it takes to give you that, to re-energize the body, sort of thing. And definitely, which I need to really get back into this, other than, YouTube, is, exercise your brain. Whether it's puzzles, I guess play the piano, get a new hobby, even just go for a walk, look at the, nature, do the exercise and, look around, think about, things. I guess memory aids. Yeah. Okay. I guess, yeah. Carry a to-do list. And that's, like I said, that's what I'm starting to do for reminders. Cause I'll go do, like, even go to Walmart. I'll go there for, like, say, cat food, which I'll never forget. Yes, I guess I have, but and I'll buy everything except what I really went in there for, and it drives me nuts. So that means I have to go back later to do it. Yeah, don't multitask. Do one thing at a time so you're not distracted. Definitely, because obviously here I'm trying to do this, read, and talk, and this at the same time. I'm getting on tangents, having moments of, for forgetfulness and this and the other. Yeah, definitely. If at all possible, unless you're just feeling really good that day and got a lot of sleep, and you don't feel like the chemo brain is as bad, sort of thing. And then I haven't done this yet. I don't know if I would, because to me, it's kind of like because see, my to-do list is like what I'm going to go to the store get, or I need to call this person. Oh, don't forget to pay that, sort of thing. So mine are all in one place. I don't need sticky notes so much, which I probably need some for like when I'm talking online, maybe like if I'm going to, do a talk on, like say, being bipolar or ADD. And I'm thinking I got to stop ADHD. But if I have it, say on a sticky note on my computer, instead of sitting there trying to have to think about it, I guess I could look up. And I just thought of that, to be honest, with the whole, sticky note sort of thing. So yeah. They're not bad ideas. It doesn't mean that you're losing it, or you're lesser than anybody else. It's just things that you have to do to help yourself get through the day. Because the embarrassment that I feel anyway, I get mad at myself, literally. Sometimes not outwardly, and even sometimes it's like, oh, I hate that, but I can't help it. Whether people believe it or not, it's a real thing, and this affects people real bad. Yeah, often the fogginess will fade when your chemo ends, but for some people, the fuzzy feeling will linger for several months or sometimes a year or more. I've stopped chemo infusions in 2018, I believe, at some time. Then that's when, like 6 months or so later, is when I started the Nexivar. And I wish I would have had my shipment or the package that it comes in. But even though I'm not on an infusion, I'm still on a chemo pill, which is just as toxic as, well, maybe not the infusion, but so I have a hard time on the Nexivar than I did on the infusion, other than what happened to my body, sort of thing. But the same things that happened then with the methotrexate. God, why can I not pronounce that now? Methotrexate and the Visibin, sort of thing, are just, ugh. But so I deal with this every day. But then again, like that were just mentioned, the more tired I am, the worse it is, or the more of a stressful day I've had, it gets worse, so I've got to learn just to say, okay, it's okay to do this. It happens. You can't help it, but take the steps to try to make it better if possible, just for a better life, if nothing more. And remember, because this is what I dealt with forever, and even I deal with that now, with people that really have no clue. And I mean, for me, I think it's more of a, some people are just trying to be mean, and they don't really care if it is a real thing or not. But definitely remember, it is a real thing. You're not just imagining this. Studies show that cancer and its treatment causes changes in the brain. Don't be afraid to ask your family and friends for support and gentle reminder. Support groups are another great idea. And definitely, if you're just starting this, especially, but definitely, I mean, I think if you've already been in this for a while, you would have done this, or maybe should have done this. But still, if you haven't, do it. Even if you've been at this for years, make sure you've got a support group. Remember, and something else I'd like to add about chemo brain, because with a lot of us that, see each other regularly, we talk, even, before Janice died, and the lady I was talking about that, had chemo 18 years ago, but she's got to have whatever it is, monthly or whatever it was, refreshing things that I just forgot what I said. Mother hoopy. Once again, I'll remember it. Oh yeah, I do remember. Sorry. That we think that there should be another term also called chemo heart. Not that, just like the brain, it's, and finding other people that do this or go through the same thing, was one thing that really helped me, because I was thinking I was so stupid. Because like I told you, I was raised not to cry or be emotional, really even. But even before I had my first session, I went into HR at work. And the lady that I usually talk to that I was comfortable with, Lisa, wasn't there that day. And so they ended up sending me over to the HR manager. So I went there to talk to him, and I wasn't really comfortable because, like, I don't know him. And this is after where I was working. They shut that plant down, so I transferred to this one. So everything was kind of new to me, but I was going to have to take time off to do the chemo. So I went in there, sat down. He's like, okay, what can I do? All chipper, all happy. And all of a sudden, got into it and said, hey, I'm going to start doing chemo. And all of a sudden, this guy got teary-eyed. And I'm thinking, what the heck, is going on? And then he said, oh, I'm sorry. I had my battle 2 years ago. He's been clean since. And, so it just, and I even think some of it may not be so much the drug itself if you're not on it, because I don't know what he was on or what he took. He might've still been on something, just to keep it, in remission. But, with being on chemo, for me, I am more emotional now, and I was raised not to be emotional than I have ever been in my life. I've got, it's like, when I think of Janice, I smile, but I also, like right now, I miss her, but it's like chemo brain. It's kind of like that. Oh, look at the cute puppy. Or, if you're not a baby person per se, it's like, oh, you get emotional, and, the chemo heart that we call in the chemo brain may actually interact or be the same thing, but you do take things more personal. You take things, maybe at times you're more combative. There's so many things that this chemo brain, does affect that, or even watching TV, the St. Jude commercial, the children's, the cancer, one, I get teary-eyed watching that every time anything's mentioned. Like with the bucket list, I have never cried through a movie my whole life, but that was probably as close as I came to doing that. I was teary-eyed through a lot of it. But for me, what was good, once again, was the support system. The girl that I was seeing at the time, knew this. We had talked about it. I said, hey, if I flip out on you, and when I say flip out, just, get loud for a second and stop. But part of my personality is that if I'm sitting here kind of bored and all of a sudden I hear a topic I like, I spruce up, and a lot of people think I'm pissed or worked up. And it's like, no, it's like, all right, you got me back in the game, sort of thing. But there are times where, like I said earlier, mood swings. But she knew about this. She knew about, that I kind of get, teary-eyed, and, and instead of like making fun of me, she put her arm around me, gave me a big hug, and we still were watching the movie at the same time, sort of thing. So support systems are important, and making sure that support system really understands what you're going through or could go through or that come up, because there's what one person goes through, not everyone goes through, or, it's so different for everybody else. It's not even, funny. It's just, like divorce. Some people go through divorce relatively fine. Other, people just have a hard time getting over, the whole thing, sort of thing. So yeah, and this is where, like, for me, the mental health part of this is really important, because if mental health, it affects so many different things, not just, cancer, but strong mind, strong body, sort of thing, even though it may not be. Okay. And then we'll do a timeout and do a check real quick. I doubt anybody came in, but, oh, hey, Majestic Beck. I don't know if you're still here. Oh, MM, how you doing? I'm about done, MM. I don't know who's here. I got the show's one in here. Whoever's in here, thank you for coming in. I'm about done, honestly. And then I'm going to jump over on Missing Mod, probably just to get some joy in my life. Anyway, I'm going to finish. Okay, what did I say? The last thing is... Okay, what is... Okay, the last thing I want to do really quick, and this is part of, like I said, part of the article that I'm that I mentioned in this, and I've got all this stuff, like I said, is linked down below. I screwed the links up, I think, unless it just doesn't show up on mine for some reason. So I may have to have somebody look at it from my world over here. But this lady they're talking about is the lady that runs or got the Desmoidian support group going years ago. And once again, I'm going to get cherry-eyed. For me, when I first started going through this, she was very influential. And the group, to be honest, it's where I finally felt that I wasn't going alone, through this sort of thing. God, I'm such a wuss. So yeah, there's Deanna. Hers is in her leg, and there's a picture of it later down below. And I think maybe this is the date of the article. Let me see. Deanna discusses her battle in desmoid sarcoma, a rare form of cancer. Even back, in 2016, yes, it's a cancer. Some say it's not. We consider it a cancer for the most part within the community because we deal with all the same doctors, treatments, and medications that other cancer peoples do. And she's, out in Syracuse is where it was. I guess I was wrong. Where it was, where she lives. But on Wednesday, August 24th, 2016, she's been struggling with tumors in her legs for 2 decades. So that's why I say, and this is why we all go by, Desmoid Tumor warrior sort of thing, because we're fighters, sort of thing. But yeah, I just can't imagine 2 decades, and then all of a sudden here I am. I started in, like I said, 05, and here it is, 2024. So I'm almost coming up on probably be next year technically, because I didn't find out what it was until the beginning of. But I don't know. Depending how you look at it, I'm either in a ninth, a part of an anniversary this year, but definitely next year will be my 20-year anniversary, from this sort of thing. I'm trying to see how long this is. Okay, I won't read it all, because really, I just wanted to touch on, how it affected me even back in 2016, and I've been part of the group ever since, and even before then. That's kind of why I was one of the ones picked to do this, or maybe everybody did it, or they could, and they just picked and chose what they used, and I was just ecstatic. Because I thought at first they only did one line of what I said, and then when I reread it last night, I was like, oh my gosh, there was more there than I can remember. Yeah, here, let me see. And this is how I relate to her so friggin' much. She fought the condition for nearly half her life. She said doctors know very little about the disease because there are so few who suffer from the ailment. So this is what this is part of what you're going to go through. Not near as bad because now you've got the internet. There's so much information out there. Whereas even 20 years ago when I started this, like I said, there was very little. But her efforts to, admin on a Facebook page, creating a whole worldwide community of those affected who are can share their experiences, helping researchers as well as those suffering. Sorry. Oh God. Yeah, I read this last night, or not all that part, but I was fine. It's like it comes and goes. If I try to shut it off, eventually it does, and I can do it. But yeah, I'm an awful crier too. I found out. And the reason I found this out is when my dad had double lung transplant, and I know I won't get on a tangent, so that's why let me bookmark or highlight that. But yeah, he had a double lung transplant like 7 years ago, or 8 years maybe ago. And he just passed 2 years ago. But this might be emotional. But yeah, Dad was trying to lose weight. Not that he was real real fat or anything, but you have to be at a certain thing, because you got to realize only certain size lungs can fit in a certain kind of cavity. So once you get a set that fits, any weight gain afterwards, especially, it affects it. But anyway, so he was getting worse and worse and worse, and literally, maybe weeks or months away from, passing. So we're trying to get him on the lung transplant. And, I was there to visit him. All of a sudden, this guy comes in and said, "Hey, I got great news. Alan got put on the transplant list." I started bawling. I really did. And Mom, we all did, obviously. And I didn't realize what kind of bad crier I was, because, like I said, I don't cry that much. So I knew I was getting ready to bawl. And I told Mom, so I'll go outside. I'm going to call my son and tell him he's on the list. He's on the list. And I mean, I'm crying and bawling. Got on the phone. As soon as I heard his voice, it's like, he's like, Dad, what's wrong? What's wrong? Grandpa didn't die, did he? Grandma's all right. No, it's okay. Finally I got it out that they, and I should have just texted him, that they got Grandpa on the list, which 2 hours later we found out was a mistake, and he wasn't put on the list. But yeah, but he made it through. But there's only a certain. Generally, when somebody gets just as FYI, is that? Yeah, FYI. I just lost the place I was at. Oh, down here somewhere. Oh well, what did I just say? Oh, anyway, screw it. I'll keep on going if I remember. Sorry. Wait, where's the part about the group? Or did I pass all this over here? Yeah, it's a great place. Deanna is, God, she's got the resources, definitely. And this is where I found my doctor finally after 11 or 12 years. Hernandez, I forgot. It's like being able to put your finger on a pulse. Who's part of the group? This is the biggest patient conversation about desmoid tumors. It's really important. Let me skip. There I am, right there. Yes, now you know about where I live and what my name is. I don't care, because I don't worry about doxing so much, just for the fact that I used to on YouTube. I went by Ron Merkley. Then I changed it to this one because it's kind of part of what makes me kind of giggle every day getting up, just because I've used it for years. But anyway. And I forgot what I said, but it's like Ron Merkley of New Ross, Indiana, said the Facebook group gave him quality of life. I go on to say I have a great support group with family and friends, but only someone going through this, can also, or going through it also can to relate. And so for me, it's peace of mind and hope. Time out. God, I didn't think it'd be this bad. He said the group was the first and only place I was around people who understood my fears and concerns. And I think I've already said that it was through this group, he said, where he finally found a doctor who had experience with desmoid tumors in his area after 11 years of calling and searching. So that was my part of the article, sort of thing, and my feelings about that group. And I guess that's why I push, having a great support group for anything to get through any kind of, disease, at least, serious disease, sort of thing, that people that you can count on. Because if you're having a bad day and you want to call or talk or just need to vent, and you don't, it is the worst feeling ever. And it took me a while to even let my family into my world. I knew they loved me. I knew they cared about me. They were concerned, but once again, the way I was raised, it was, real men don't need help, rub dirt on it and go on. And not that he was anti-doctor by any means, but, just like the aftercare or, whatever, go suck it up. Don't matter what you got, just deal with it and go on and quit being a wussy. So I'm trying to think. Oh, and then see, this is Deanna's. Hers was in the leg, and you can see how much damage and how much muscle was taken out just, to remove it. And I can't remember how many times she's had surgery. To be honest, it might be in here, but then that's only up till 2016. It's not, what she's went through, following. And actually, if you're not even going through this, just want to know, read some of the stuff that she's got to say, because I would read it, but obviously I'm a crybaby, sort of thing. But that is really it. I do think that what I'm going to end up doing, since it's oh my God, 3 hours. I didn't realize that. I'm going to have to find somebody that is really good at editing. So then obviously this is going to be on some part, 2, 3, 4, or the end of part 4, whatever it might be, that can help me. I've got the program. I'm such a procrastinator. I've got a brand new laptop that I've had forever, but I use this little Chromebook because it does everything. It does what I need for the most part, but I know I can't run a, video software program on it or anything that, because and the other computer is like, 50 times this thing, but I'm just so used to this one right now. Yeah, for now, I'm going to leave this in, almost 3 hour thing on my website. And I want to find out how and what if I do have a longer one, if it has how to do the whole, like skip through to a certain thing, that's, like a section that would be like, say we're talking about numbers. Okay, this is, the number 1, number 2, they just click and get to what you need to. And on this one, like, what is the tumor? If you're worried about chemo brain, or like, say you see Nexavar, that's what you're looking for, just click on that so you don't have to watch it all, especially for those that have been already through this for years, like me and, other people. Yeah, sorry about the emotional stuff. And if you're watching this and it helped, I'm glad. To be honest, if it doesn't help anybody, it's helped me already, because I've already remembered stuff I kept forgetting about, and even a few points that I didn't even know about, sort of thing. So I'm going to shut this one down. I've got and I don't know why, I just got to play it because a friend of mine over here in my usual world, one more thing, I actually got another website, or no, another channel that I've started. It's not really up and running yet, because I want to separate like this stuff from, say other topics, to me, and really my other channel is going to really probably focus more on a lot of different medical things, even things I don't know. I want to explore. I'm the type, I love information. And it's like the hobby. And maybe that's the thing that I need back in my life, because when I do the same stuff, like I said, I'm an atheist, and I argue, fight, discuss, and it's gotten old, and it's actually affected me, mentally, with that whole lifestyle and, the commitment thing. I've had falling out with many people, whether it's my fault or not, and that's when I finally decided I need out, so I probably will keep this one for the Jack Black trivia. There's my email. If you need to talk, don't feel like you're a bother. Honestly, I was there with you. Email me. I will get back to you. I swear. I just set this up, and I haven't even checked if anyone's ever used it, but now I will check it every day, whether somebody uses it, to contact me or not, just in case that one person, or, how many need somebody to feel like you're not the only one, because you're not, no matter what you're feeling, no matter probably what test, no matter your diagnosis, there's somebody out there that can relate to you. I promise you this. And I do promise you that there are, groups like the one on Facebook that is pinned in, the top of the chat. I'm there. Obviously, my name now, so you know who I am. There's others you can talk to. You can go there and not even talk to me. I don't, I won't take offense to it. As long as you go there and you went there, for whatever reason, then I did my job, sort of thing. And I don't usually promote, but they, you don't know Jack trivia is on for now, and I might actually change it to a different day. But I'd done it for 9 o'clock for so long, and then all of a sudden I realized, well, hell, I'm on my own. I can pick the day, the time, do with it as I please. And I've got several people that have helped me with like intros and outros. And now I'm going to put this channel on hold because I want some. I know what I was talking about earlier, but I want some avatars like DT Warrior or something. But this is the one I mentioned it before I go. This is the one that I remember to take it down later because this missing mod comes in. She'll kill me. Okay, I'm gonna stop the camera just for a second. Then I'll come back. And then this is done. But this is the one that I was using for a while. Warning: I've got chemo brain, and I really kind of want to have a talk with some people to say, hey, this isn't necessarily a bad thing. Maybe I need it to, just to look at it and kind of giggle and laugh or, whatever I need to do with it. But yeah, see, I've got chemo brain avatar that I found online through our group, actually. I do got a hoodie about, fighting desmoid tumors and sarcomas, keychains, all that stuff. But really, that's just, some of them were even gifts. But please, if you need to reach out to somebody, I'm your man. Whether, like my name says, an asshole or not, I take this topic very seriously, and I will put my 100% effort into it. If I don't have the answer, I can get you the answer or a better answer if need be. And sometimes that's all it takes is something better. But I'm going to just keep rambling the same thing. So I'm just going to shut this down. Oh, wait, that's what I was going to do. I almost forgot. Oh, my goodness. This is just a short version. I used the other, my trivia intro, I think, when I first started this, because I don't even know why, because I was listening to it. It's like 4 minutes long if I played the whole thing, but I play like 3.5 minutes before just to get in the mood. But I actually got somebody to work on that because I'm afraid of possibly. That's why I run it so short. I don't want to cause seizures if that's actually could do that sort of thing. It's safe than sorry, but he'll be my outro. It's only 15 seconds long, and this can give me practice too to when to time it where it just actually shuts down at the same time as the stream. But here it is. Thank you for coming all, and hope to hear from some of you if you need it. Thanks a lot. Bye.